Good morning and welcome to the February 27, 2015 CDBG Advisory Committee meeting. We start with roll call, please.
Committee members Markarian.
Here.
Olivares.
Here.
Ramirez.
Here.
Bastian.
Here.
Chair Armenian.
Present.
The agenda for the February 27, 2015 special meeting of the CDBG Advisory Committee was posted on or before Tuesday, February 24, 2015 on the bulletin board outside City Hall. Item 2 is minutes. At A, approval of the minutes of the October 29, 2014 CDBG Advisory Committee meeting.
Anyone have any comments?
I don't remember if I was here.
It was a while ago.
Yeah. I don't have a copy of them.
Everybody was present on the
Okay.
October 24th meeting.
Okay. I move approval of the minutes.
Second.
Thank you.
So moved.
Bring it up.
Committee members Markarian.
Yes.
Olivares.
Yes.
Ramirez.
Here.
Bastian. Chair Armenian.
Yes.
Item 3 is oral communications. I don't have any cards.
Okay. So before we move on to the next item, which is the main part of our agenda for today, just to outline for those who may be viewing this morning at this early hour, this is a special meeting of the CDBG Advisory Committee. It's one of two meetings on an annual basis to review proposals for the next program year, where we will be spending a large part of today hearing from the many groups who have applied, put in proposals for funding for a variety of different programs that meet the criteria for the city's strategic plan when it comes to these sorts of programs. We will be going till approximately, I expect, at least to about 3 p.m. today. We will take a break at various points. We will be hearing initially from the actual applicants, after which this body will deliberate in order to come to a conclusion in terms of what sort of recommendations to make to City Council for the programs. On Monday, we will continue this sort of special meeting, but it's focused on capital program proposals, and we'll talk about that at the end of this meeting. As a general comment, funding continues to go down in terms of available funds, and the number of proposals continues to go up. So I believe my fellow commissioners will agree with me that this year's session will be that much more difficult when it comes to making the decisions because there's less money, more proposals. But we'll do our best to focus the discussions and see how we might come up with an appropriate recommendations like we did last year. So, shall we continue with the next agenda item?
Sure. Item 4, business agenda A, reports information only. At 1, receive report regarding second quarter fiscal year 2014-15 social service performance reports and expenditure rates.
Good morning, Mr. Chair, members of the committee. In your packet, you should have a long spreadsheet with the current fiscal year 2014-15 social service mid-year performance report and expenditure rate. And I won't go through entire project by project, but this will give you an overview of the current projects currently funded. And also these are the applicants for this year as well. So this will show the current funds awarded, the amount that expended, the proposed number to be served, and the actual number served as of December 31st, and then the outcomes, and then, of course, the ratio, the expenditure rate. This gives you an idea of how agencies are performing and how some also have, there may be expenditures that aren't fully 50% because some of them do start a little later in the school year. So you're missing, the 3 months there, or they may start later in the program year. So staff has not observed anything out of the ordinary, anything that would question someone's performance or the expenditure rate, nothing that would come to our attention to bring up to you that would cause any issues of eligibility or performance. But if there's questions on this, we'd be glad to answer any questions regarding the report.
I have a couple questions, or at least one. So is it up to each organization to decide for themselves exactly when they might start their program? In other words, what's the parameters we give them? Because I noticed there's at least one program that started December 1st, 2014, whereas we allocated the funds much earlier in the year.
That's a good question, Mr. Chair, members of the committee. The agencies are allowed to provide a program schedule based on the funding availability, based on their program design. Some do start, as you mentioned, December, and I think that one is a tutoring program to finish off on the school year. A lot of youth agencies start in September because that's when the school programs start. CAS is one of them. But to answer your question, yes, we allow the flexibility of the agencies to operate the program according to their program schedules, what's best for them. Obviously, if they start way late in the program year, that's a little bit more concerning, but that's a very good point.
And so my second part to that question is, so if I look at the funds awarded versus funds expended, on many of them, there's a lot of money still on the table that hasn't been invoiced, I guess, to us. Is there a deadline by which those funds need to be spent and invoiced, otherwise they lose it, or how does that work?
Yes, Mr. Chairman of the committee, there are various reasons why some haven't spent the money, and it pertains to their actual budget, and some have criteria or other program funds that match the funds that we provide them, and they'll expend their funds. Let's say it's United Way, where they need to expend those by December 31st. So they'll spend those first and then tap into the CDBG funds secondly. There is no necessarily a deadline. However, this particular report does give us a little bit of warning to advise the agencies that are not 50% expended to look at their expenditure rate and provide staff a reason why they're not expending their funds. But the timelines that we usually have is around March. If they're not expending funds and they're not have a reason why they're not expending the funds, then that brings up a concern. And we've had in the past provided the committee a report saying that we were going to deobligate funds from agencies that we would think that we're not going to spend all their money.
And what happens to those funds if they are not spent?
Mr. Chair, that usually comes back to the committee, and we usually do either what we call a mini RFP, and RFP those funds back out to the agencies, or the committee could decide to make decisions based on some staff recommendations or their own deliberations on where those funds can be distributed to.
Now, that's true for the social services, but not necessarily true for the capital programs, right?
Correct, Mr. Olivares. It's the capital ones do tend to take a little longer, and because of design and permitting and I would say bidding process does take a little bit more time.
Other questions?
Well, Mr. Chair, there's a couple
Please
of
turn on your mic.
there's a couple of agencies that have not expended any monies whatsoever. And I'm just curious as to why that is so. Perhaps I could address that when those agencies come in, and perhaps I could get a response to that, unless you know.
We know one particular agency that has not expended their funds, and that's the Essentia Homeless Outreach Program on that first page. And we have been in touch with them. Their program does expend their matching funds first, this is for homeless outreach, and they expend their matching funds first, which is part of one of their requirements from their funding agency. And then we actually do have an invoice from them already just for January for the next 6 months. But we want to work with the agencies to understand their budgets and their funding resources as well. They're an agency that every year has spent over 100% of their funds. But it's another example of an agency required to have matching funds to run and operate program and expend those funds first, and then our funds get expended secondly. As long as they're in the process and they have given us an invoice already.
I also think what's important for us to take a look at is the number of, people they serve, and if they're on track with that because we know the invoices will come in because you are keeping track of those. But when it's alarming to me when I see no members or no activities or no program in place yet. But when I look at this, it seems like they are serving members, they are doing the work. It's just a matter of timing with the invoices. So I look at both sides, but looking okay to me.
Okay. Any other questions on this report? Okay. Next item.
Item 482, receive report regarding financial statements for community organizations.
Yes, Mr. Chair, members of the committee, in your analysis of the proposals and what we provided you is a small, I guess, one-page summary of each of the agency's financial statements. And each agency is required to submit audits, submit financial compilations, financial statements for 2 years. And what we do in finance, our finance internal auditors do a analysis of those statements and give those what we call some ratios. And we have staff from internal audit to make a quick presentation to discuss and summarize what those processes are and how the spreadsheets are put together. So I will defer to Eileen to discuss this a little bit in detail.
Thank you. Good morning, Mr. Chair
Morning.
and members of the committee. My name is Eileen Donahue. I am the Internal Audit Manager with the Department of Finance Internal Audit Section. The Internal Audit Section consists of 4 auditors that provide the internal audit function for the city. Each year, we complete an annual work plan that identifies our audit projects. One project on our work plan for the past 4 years has been to provide assistance to the Community Services and Parks Department in performing the financial statement ratio analysis for the applicants that are applying for CDBG funding. I would like to acknowledge my coworker, Natalie Minami Valdivia, who was the lead auditor on this project and worked closely with Mr. Carrillo to review the financials and complete the ratios that you have in your packets for the applicants seeking funding. We computed 6 ratios. These are the same ratios we have used for the past 4 years in our analysis provided to the committee. These ratios were selected because we found they provided a meaningful financial indicator when evaluating nonprofit entities as opposed to other ratios that may be used for industries earning a profit. The following is a brief definition of the 6 ratios we calculated, beginning with the functional cost allocation. This ratio reflects the percentage of funds being spent on non-program related expenses such as general and administrative cost. A lower percent indicates the entity is paying more on program related expenses. The current ratio is a ratio that reflects the organization's ability to pay obligations in a timely manner, usually within 12 months. Typically, a ratio of 1 or greater is a good sign, suggesting that an entity would be able to pay off its obligations if they came due. The debt ratio is a ratio that reflects the proportion of debt a company has relative to its assets. It works opposite the current ratio. A ratio less than 1 is a good sign, which indicates that a company has less debt than assets. The 4th ratio is the defense interval. This ratio reflects the number of months that an organization could operate if funding stopped and no additional funds were received. The reliance on source income is a ratio that identifies the potential risk as a percent if the largest source of revenue were eliminated or reduced. And the final ratio we calculated was the fundraising efficiency ratio, which reflects the average dollar raised for each dollar spent on fundraising. In considering the results of the material, it is important to consider all ratios calculated for an entity. Focusing on only one ratio by itself is not a fair indicator. I want to also let you know that in performing our work, we did not recalculate any of the numbers from the financials provided by the applicants. We took the numbers represented in the financials and performed our calculations. 9 agencies submitted either current audited financial statements or compiled financial statements prepared by an independent accountant. 1 agency submitted a draft audited financial statement for the most current year, and 2 agencies were in the process of completing their audits and provided prior year financials. We hope the information from the ratio analysis provides a tool to assist with the evaluation for the funding decisions. We are also available to answer questions on the analysis we performed and will be at our office during the day if you'd like further information or clarification. Thank you.
Any questions?
Question. Did we eliminate any agency this year because they didn't submit financial statements? Were there any agencies that we denied proposal?
No, we did calculations on all the applicants that we received financials for.
And all the applicants did submit financials? Because I remember in the past, we've had this issue of not every agency had a formal financial statement.
Yes, Mr. Chair, Committee Member Markarian. Yes, there is 2 agencies that currently have not submitted a 2014 audit, and that's Essentia and the Housing Rights Center. We have been in communication with them that their audit is in the process, and they just are almost wrapped up with their audits. They have told us as soon as they get them, which we know that one will be turned in next week, that's Essentia, and Housing Rights Center the following week. However, we kind of know the agencies, and we know that their information is being reviewed by auditors, so there's no disqualification on our part. However, we do make monitoring concerns and findings on submittal of audits that are not submitted on time, because that's actually a current year program requirement. So in their monitoring, they do get cited for not having their audits on time. But there's no concern as far as not having it done, because we are in touch with their auditors as well.
Commissioner Olivares?
Yeah, a couple of questions. When did you start doing your reviews of their audits?
Mr. Chair and members of the committee, we began the review in January was when we obtained the financial information.
My question's a little bit like how many years ago did you actually start looking at the financial audits?
I believe it started 4 years ago.
Okay. So that was after we had our issue with the one big agency, and that's where I was going with the question, so that having you on board and looking at this will help us not find ourselves in that situation again. So,
right.
Thank you.
And for the entities that have not provided current financial statements, we did do the analysis based on the prior financial statements that were provided to us, and those were separately identified in the audit that we provided to the department.
Mr. Carrillo, I have a question. If for those, even though there's a track record of those agencies who have not submitted yet, without the submission, can we allocate money? I mean, is it a requirement to have gone through this review process with finance, as well as us having the information at hand in order to make decisions?
Mr. Chair, members of the committee, I mean, it is certainly a requirement, whether or not we term that a hard requirement. Certainly, if you're inclined to, you can always make certain grants conditional upon their submittal of audits, financial statements. That could be something the committee could review, but it's not an absolute deterrent for an applicant to receive funds. However, certainly that's something the staff is looking at currently, because one of the reasons why the audits for the larger agencies are taking longer is they are required, for the city's sake, to have an audit 6 months of their program year. However, the federal requirement is 9 months. So they're actually in compliance with the federal requirements of within 9 months, but the city is a little stricter, has a stricter standard. And so we've worked with them a bit to ensure that within 6 months or shortly right afterwards, they're completing their audits. But there is a 9-month federal requirement for their audits for the big, large organizations.
So when you say the city's got a stricter requirement of 6 months, is that a staff requirement, or was that a requirement that the committee, the CDBG committee, imposed on them?
Mr. Olivares, members of the committee, there actually was a report submitted after the agency that we discussed earlier, and some new financial requirements were made at that time. So that was a time that the city council accepted some changes that were brought up to the committee as well. This was something the committee...
So the city council made a decision based on our recommendations.
It was based on the internal audit recommendations, and this was certainly passed by the advisory committee, but it's certainly something that we needed to get better direction from our internal auditors as far as a timeline when proposals are there.
So, I mean, I go back to what's being asked, which is, technically speaking, are they not meeting a requirement that would prevent them from accepting any funds or as disbursing any funds? And so we need to know that so we can make decisions accordingly. And I know the organizations, and certainly that's not what I would like to do, personally speaking, but I think it's something we need to discuss and get direction on.
But in performing your audit, you take into consideration that there is a 9-month audit available from for the federal.
We recognize that the federal requirements are that they have 9 months to
And
complete
then you have
their-
that information.
we know that information, yes.
You have the audit, federal audit?
No, the audit that we receive is the one from the agencies.
Okay.
And our requirement says right now that it's 6 months, that they're supposed to have it done within 6 months of the year end.
But it's acceptable. You find that acceptable?
That it's 6 months? It would be better if it matched the federal requirement to be the 9 months.
Yeah, that's more important.
And Mr. Correa, am I understanding it correctly when you're saying that some of these agencies, because they are trying to meet federal requirements, they're waiting to have that period of time to do it, or it's just that they're late in doing it?
Mr. Chair, no, they understand our requirements for the city. And of course, these questions could be directed to the agencies, but our understanding that some of them had some changes in their financial accounting, and so they're delayed in one agency by, I would say now it's a couple of months now. Other agencies, another agency had a delay because of getting information from basically their cities. They service about 28 cities, I believe. So some of them have reasons for this. But again, our requirements are a bit stricter than the federal requirements, and it's something we need to look at given the fact that it's nonprofits have a different, not a financial process, but have different processes than a for-profit business as far as the timelines that they have and the time they have available for audits. They are being done. They're just not finalized by and signed off by their CPAs.
Okay.
And wouldn't having had to fund 2 audits raise the cost for an organization? If you have to do an audit 9 months and then another one at 6 months, that would be 2 separate audits, 2 separate costs.
Committee member members, it's actually one audit that would suffice for both agencies.
Except that
It's one audit.
timely.
Yeah. Yes, one federal requirement is 9 months. The cities is 6 months. So ours is a little stricter, and find that a little bit challenging for some of the agencies. And so that's something that staff will need to look at and work with internal audit, that we may have some leeway of giving maybe extra time or follow the federal rules, be consistent with them. But certainly certainly for our sake, we want to make sure that they're being done and not delayed 9 months. Then they say, well, we need a year. So we want to be consistent, but we also want to make sure that the timeliness is very important for us, to have that information for internal audit to review their audits and for the committee to make prudent decisions on their funding.
So my suggestion is let's hold questions for those who have not submitted. We'll ask those when they come in. And then I would also suggest that we maybe agendize this issue at a future meeting in terms of discussing this audit issue. Maybe we can come up with some sort of solution, or at least examine it a little bit more thoroughly.
Thank you.
Thank you. Next item.
Item 4B, action items. 1, review and approve revised fiscal year 2015-16 CDBG proposed funding allocation plan by funding category.
Yes, Mr. Chair, members of the committee, we had anticipated.
I apologize. I actually skipped through one of the items. If you don't mind, I go back to item 4A3.
Yeah.
So I'll read that into the record.
Yep.
I apologize. 4A3, review proposal evaluation process and interview and deliberation protocol.
And Mr. Chair, this item is put on for our information only. Again, that's discussing the process we will use, the committee will use for its interview and deliberation of the agencies. And this is something I know in the past we've moved to the actual, after the action item B2, or I'm sorry, before B2 and after B1, just so however we can still discuss how we would anticipate. In the past, the committee has followed the protocol of allowing agencies 5 minutes to discuss their proposal, followed by 10 minutes of questions and answers. And that kind of been the standard for a number of years. Unless the committee would like to deviate from that, that's what staff would like to continue to recommend, that we allow the opportunity for the agencies to allow them to present for 5 minutes their proposal, followed by 10 minutes of questions. We would like to time it so that we can see where they're at in 15 minutes. It's certainly a discretion of the committee member to allow them extra time if they're wrapping up or if there's additional questions. We're just trying to keep the schedule, but again, we will leave that up to the committee to make that decision.
Well, my approach would be, I think it's a good guideline. Let's use it as a guideline. I certainly don't want to cut off any meaningful conversation and discussion. These are important issues that we'll be discussing. We don't want it to turn into a half-hour, presentation on everything. We want it focused on the proposals. But I'll manage that as chair. Let's start timing it, but I don't want to, like I said, create undue pressure for them to squeeze everything in. We'll kind of play it by ear. If my fellow commissioners agree with that approach.
I agree.
Okay.
That's fine.
And Chair Armenian, members of the committee, I would remind everyone that you also have in your packets evaluation forms that you'd be filling out as you go along with the interviews.
Okay, before we start the interview process, would you like to give a brief overview of our funding and what was eliminated, a brief report on?
Yeah, I think that's the 4B1, right?
Yes, Mr. Chair, members of the committee, yes, there is unfortunately, a significant change in our funding allocation, what we anticipated receiving from HUD. And, we're being optimistic. However, the government doesn't seem to be in our favor this time. They did have a funding cut for CDBG programs, basically throughout the country, but some, of course, more significant than others. We did get a funding cut of what we anticipated of $119,939. We were anticipating $1.7 million. We are receiving about approximately $1.5 million. That's certainly a dent in our public service funds, where we now have, as you've seen, is a $237,000 public service fund available for the social service projects. That's a reduction of $20,000 from last year. So certainly it's getting tighter, and as mentioned before, proposals still come in and overall over the amount of available funds. The other critical item is the amount of capital funds, which have again decreased from the $1.1 million to about a $1 million decrease. And what staff, with the direction of the director, has proposed that we keep the programs that were pre-designated, such as code enforcement, Section 108, at their same funding amount. And we would keep also the nonprofit undesignated community projects the same as approved by the committee and the council at $350,000, so we don't disrupt that RFP process and have that flexibility. We did eliminate two programs, well, one program, which is a homeless employment program, which was approved by council and the committee from $50,000 to zero. And we reduced our Palmer Park project from $128,000 to $100,000 approximately. So the cuts were made with internal city projects. We did not want to impact certainly the nonprofit projects that had already submitted proposals for the $350,000. However, the cut for social service is based on a percentage, so we had to cut that based on the 15% of our entitlement amount, and that's where you'll see the $20,000 cut. Fortunately, that does put a dent in your overall funding that you could allocate today. So overall, we hope that HUD will soon pick up the funding for us and hope for a better fiscal year 2016 next year.
I have a question on the pre-designated. Are those open for discussion in terms of this committee making a recommendation, or are those decisions already made by council?
Council has made the decisions on the pre-designated projects. They're certainly their highest priority projects that they anticipate, and we really have no choice on the Section 108, and that's an automatic payment to HUD.
Mm-hmm.
However, again, from our staff perspective, we made the cuts to the homeless employment in Palmer Park because we definitely wanted to make sure that you have funding available to allocate to those capital improvement projects.
What about code enforcement?
Code enforcement is another one of those that were approved by the council as a...
At this level, though?
At this level, yes.
In other words, this dollar amount?
Yes, that was the dollar amount proposed from... And again, that's a cut from the previous year of 376, and it's been reduced slightly each year.
All of ours.
I know we discussed this last year, and I personally have always taken the position that if the nonprofits in the city have to take a cut, I think the city should act accordingly. Now, I know the 108 has to be, it is what it is. But in terms of other pre-designated projects, we know the city budget is changing, the general fund is changing, and I think it's something that we should discuss. The graffiti control or code enforcement, that's a one-year number. Doesn't have to be necessarily the same number the next year. But I just think we need to be balanced out with the nonprofits in our city. I think it's something, now we're speaking specifically of capital programs, so
I have a different
suggest
opinion.
that we discuss that at the end of the
Yeah,
that we discuss that maybe at the end of the day or prior to the review on Monday.
okay.
Yeah, so, sorry, let me allow you.
Yeah, I just have an opposite thought on that.
Okay, so let me suggest, I agree that it's an important issue, and I do remember we spoke about this before. It's, especially as money gets tighter, this becomes more of an issue in terms of not just the what, but the how.
And the why.
Is my issue. So maybe we can save this for Monday since it has to do with capital projects.
Yes.
I have
Correct.
just one question, Mr. Correa. Looking under revised HUD allocation, when you total the 207 and 100,000, the total somehow, it's a little off, the 350 versus 350 on the other column. I mean, we're missing the 50,000 under homeless employment program, but yet it totals 350.
Committeemember Markarian, no, that 50,000 is part of the pre-designated funds.
But I don't see that designated for 15, 16.
Again, the city,
Lies.
we eliminated that program.
Okay, so
so
shouldn't
it's
the
zero.
total be
So where did the money go?
307 instead of 350?
I think the question, Commissioner's question is, where did that 50,000 go?
That went to offset the reduction in funding. That was a cut because we had to reduce $119,000
Right.
from.
But the total should not be 350 for undesignated community project. It should-
That was not an undesignated project. That was a designated, pre-designated, approved by City Council project. So the 350 does remain the same. We're not adding to that because we had to reduce the city's
Look at
projects.
if you look at the pre-designated projects, the bold line at top, you'll see the reductions, 834, 755, 677. right? Am I reading this correctly?
It's right under the capital neighborhood improvement projects where it says pre-designated projects and the allotted amounts that go
In other words, the
across.
350 is for the undesignated. It's referring to the undesignated.
I'm only referring to the undesignated.
Yeah. It's not the total of the pre-designated. The total of the pre-designated is 677,061.
Yeah, I see that. The way just totaled it, it just confuses me here.
So
Yeah, it's totaling up versus down, and that's the
Right.
different accounting system there.
Okay, the one question I had was, so we're going from our anticipated 1.7 million to $1,580,061. Just for the sake of giving information to the public, how did you calculate your 1.7 versus what did HUD do where there was that shortfall? Why was that? Why did HUD, in other words, give us less?
Mr. Chair, members of the committee, we had anticipated receiving approximately equal, a slight reduction in funding from HUD in our allocation, and that's the best guess estimate we can do based on what Congress had approved in their budget as far as funding. What we anticipated was, what we didn't anticipate was a cut came from a variety of factors, and we discussed it before as far as census figures. They're still using that census figures we had several years ago where our population had decreased and our poverty level had decreased as well. Those are primary two factors in allocating funds throughout the country. So if another community has a rise in poverty, a rise in population, that will reduce our funding because they take it from a different entitlement city. So it's a very tricky formula, but essentially a community could increase in population overall, and that would mean they would get a higher entitlement. They don't calculate exactly, well, their need may not be as high as we are, but they base it on these models. And we thought that the newer statistics that show Glendale increasing population, as we know, we are certainly going to increase very significantly this year, that we would have some flexibility in getting our funding increased or kept level, but that did not occur. They're still using some older models for population. We will check again and see if there's something that's going to occur next year as well, because we were told that this is, probably they go by 3 or 5 year models. So 2015, we would anticipate now the population to shift a little bit, higher population, and see if we get additional funding. But some of it relates to poverty, and our poverty has been reduced. And we can say that, community development certainly is a vital tool for reducing poverty and working with agencies to assist those. And maybe, some success has come from our programs. So it's a good thing, but it's also, I know it's challenging to have the funding reduced by the basic numbers that are given by HUD and the census.
If I may suggest, it's not my job to tell the city how to do its business, but I do understand that Mayor Sinanian will be in Washington, D.C. in 2 weeks on a lobbying trip for this in behalf of the city as well as in behalf of the region, a trip that I'll be participating with the LA Chamber, but he's also going for the city of Glendale. Perhaps the lobbying firm can set up some meetings with HUD where he can discuss this issue. I know he's passionate about CDBG, being a former member and chair of CDBG. It'd be great to see him maybe apply some pressure to our friends in Washington.
Absolutely. Thank you. Mr. Mayor was certainly a member of the CDBG Advisory Committee, and
So
he knows very well the
He'll
process.
be there in 2 weeks, week of March 16th.
Now, this is an action item, correct? So we need a motion?
Yes, Mr. Olivares, we do need a motion approval of the
Now,
funding category, funding plan.
what happens if we make a motion to move it forward and then we want to make a change on the capital programs or at least make an alternative proposal on Monday?
The bottom line doesn't change.
And that's why I'm asking. So
would be the time for them to make a different recommendation.
Or
Well, I know, Mr. Chair, Mr. Olivar, I know in the past, the committee has certainly approved the plan, and then at the following meeting, make, for example, what they call Plan B. If there's, and again, we have to evaluate the proposals on Monday, and if there is proposals that you would like to fund that put us slightly over our funding amount, then that would be a note from staff to council that some projects would like to, the committee would like to review and have fund some projects. But we can't tell right now because we haven't had that discussion
We have
yet.
to move this.
And we can't move part of this, right? We
Yeah.
can't just move the social
I
services
think you need
component?
to approve the whole.
Would a motion, if I made a motion to approve as proposed, conditional on our discussion on Monday, that meet the guidelines?
I think you would have to do, Mr. Olivar, is make this would have to be agendized again on Monday for a change to the plan. Obviously, we would prefer the method we used in the past is offer an alternative recommendation on the projects. So let's say it's $350,000 and you want to add $20,000 more. That would be a recommendation you would add to the proposals, and staff would bring that recommendation up to the
So
council.
let me understand this correctly, because I have no doubt we're going to have difficult decisions later on today. But if we, let's say, our funding decisions for the social services programs is $50,000 over the allocation as you have it in this proposed budget, we could turn around and
can't
say.
really do that, though.
No, but what I'm saying is, like, but we can't say, we would like, let's say, to reduce code enforcement by $50,000 and move it over to
They're two separate.
whatever.
No,
They're two separate.
Can't do that.
capital.
That's social
Can never
service
bring
and
that money
capital,
over.
yes.
And in
But
order
could-
for us to actually evaluate and make a recommendation, we need to really make final decisions,
We need to listen.
close and.
Yes.
But all right, Monday, when we're talking about capital programs, can we do something like that?
Yes, you
Plan
can
B?
look at what alternatives and what other alternative recommendations you may have
So
for,
in other words, if
looking at-
50,000 more on Palmer Park or something, or
Correct.
one of the undesignated.
Correct.
Right? We could turn around and say,
Right.
we would, we're 50 over the allocation, and we would like to take that from one of the pre-designated. We would like to recommend the city council.
Correct.
Reallocate 50 from the code enforcement. This is just a hypothetical. To.
That's what we said, we'd discuss that on Monday, right?
yeah, that could be a discussion on
Okay,
Monday.
so even if we approve this the way it is today, we could, in our recommendations on Monday for capital projects, make that sort of Plan B
That's all I
recommendation.
Yeah,
want
that's what he
to
said,
make sure.
yeah.
Have that flexibility, that's all.
Okay.
So with that in mind, then I'll move this item,
Second?
motion for approval.
Do I have a
Second that,
Okay.
Committee members Markarian,
yes.
Olivares,
Yes.
Ramirez,
Yes?
Bastian,
Yes.
Chair Armenian.
Yes. Okay, next item.
We have patients, people.
Item 4B2, conduct interviews with social service applicants and deliberate and approve funding recommendations.
Yes, Mr. Chair, in your package, you do have the funding proposals from each of the agencies. You also have the analysis from staff and the submittals of the response to the analysis, whether, some weaknesses in the responses, and of course, the evaluation forms for each of the agencies. I know we're a little bit behind schedule, so we can just follow your protocol.
Yes, and I'll just for visibility perspective for those in the room as well as those viewing on TV, just to give you a sense of the order that we'll be going in. So we will be hearing first from Door of Hope on the transitional housing program for homeless women and children. We'll next hear from Glendale Healthy Kids, access to health care for underinsured children and students. We will hear next, third, from the Salvation Army on the Zone After School program. We will then hear from All for Health, Health for All gift program expansion. Then the Home and Men Glendale Arat chapter on after school tutoring, and Housing Rights Center fair housing program. That will take us to approximately the 10 o'clock hour at some point. In theory, we will take a break at 10 a.m. We will probably run a little bit over that since we're a little bit behind. So that's the next hour. So if I invite the Door of Hope up.
Well, good morning.
Good morning.
CDBG Advisory Committee members and staff. Thank you for the opportunity to share with you about another opportunity for you to partner with us to be able to help make a difference in the lives of homeless families and children. As you're aware, Door of Hope, our mission is to equip homeless families to rebuild their lives. It's our goal to break the cycle of homelessness permanently. This year, Door of Hope is celebrating our first 30 years of helping homeless families go from homelessness to self-sufficiency to permanent housing. At our Door of Hope Glendale Hamilton Court project, we serve around 40 women and children at any given time, including 13 families and around 27 children. We provide a very comprehensive program, including case management, counseling, life skills classes. We have budget and finance, help families get jobs, help families with housing, advocacy, and placement, as well as a comprehensive after-school program. The 2014, the last released homeless count here in Glendale, revealed that there was 45% of the Glendale population were members of families, including 52 children, of which 28 would be 28% of the homeless population here in Glendale. A significant part of these homeless families are also homeless as a result of domestic violence. Door of Hope is part of the Continuum of Care Network with many other wonderful agencies that are helping to work together to be able to break the cycle of homelessness and to solve homelessness permanently. I'm proud to report that our past and current CDBG funding has been extremely successful and producing successful outcomes. In the last 4 years, Door of Hope has, in Glendale alone, averaged at least 100 families, including over 200 families in the last 4 years, have come through our program. For me, that's exciting because I love kids, and that means that there were 200 children that were homeless in the last 4 years here in Glendale that are not homeless today. And Door of Hope is a unique organization because most programs serving families focus on the parent. The parent needs a job, the parent needs housing, the parent needs case management, the parent needs counseling, and so on. But many programs, you forget that when the children are homeless, they are falling behind academically, emotionally, socially, and many, many other areas. And so Door of Hope really focuses on the children as well. Door of Hope is one of the few places that has a comprehensive services for children that are homeless and homeless as a result of domestic violence. Our comprehensive after-school program runs Monday through Friday. It involves a healthy snack. We have recreation. We have homework and tutoring. We have mentors that come. We have life skills classes and computers and an array of different activities that help promote the academic, emotional, and social promotion of the children and helping them as well as the whole family. Our priority on the both family and child is one of the reasons why we're so successful in actually breaking the cycle of homelessness, not just for one family, but for the children and the children's children. HUD is, as you know, is in the process of reprioritizing and cutting funding for numerous transitional and domestic violence housing programs which have been lost. Door of Hope remains as one of the few that is in the community that has a huge, that includes a huge need in our community and surrounding communities. To conclude, I want to, we have an incredible privilege of having one of our families that are here with us today that is currently part of our program, and then I'd come up and like to close just with a summary at the end. But I'd like to invite Mita to come up and share a little bit about... Thank you for your concern. Yes, as a domestic violence shelter and transitional housing, it's extremely important to not disclose any sensitive identity issues, and that was our concern as well. Mita has agreed that is not an issue, so we will allow her to share with you. Thank you for sharing.
Good morning.
Morning.
I'd first like to thank you for actually hearing what I have to say. I have the privilege of coming to Door of Hope on April 30th of last year. I came from an emergency domestic violence shelter with my 2 young daughters who are 5 and 4 now. And I didn't know what Tim was going to say, but I actually, I'm coming really to just reinforce what he said without knowing what he was going to say. Women who come like I was in a time of crisis are, one of our obvious concerns is shelter and safety and security, which is addressed, but another primary concern is our children and child care and programs for our children. And like you said, the Door of Hope has really offered a comprehensive program that allows not just assistance for myself and growth personally and assistance from the relationships that Door of Hope has created with the community, but also my children. I think Tim and the other staff at Door of Hope can attest that today the 2 little girls that I have are completely different little girls than the April 30th when we walked in the door because of the services that we have received at Door of Hope. My girls are preschool age, and they had issues that are characteristic of children in crisis and from trauma. And just the programs that they offer made us feel so safe, and once I had that feeling, I'm able to relay that to my children, and I have really been able to see them grow and thrive and really become confident little girls at 4 and 5. And I'm sorry if I get emotional about this because it's a really emotional topic for me, but I don't know that we would have had this opportunity anywhere else. We were able to receive services, and because of the program they offer, not just with the funding and the programs that are there, but also the staff and the nurturing and the environment that it provides for us. I think, just to sum it up, for me, isn't this what all of this is really about anyway? It's to provide a better future for our children. And I think that's what it's done for us. Thank you.
Thank you.
I know our time is up. I just will close with just saying this is just one of many families that currently live with us, as well as the hundreds that have come through our program, many of which are actively members of the Glendale community, of which we had one a couple of weeks ago that just graduated, lives in Glendale. Market rate housing, has a job, is fully self-sufficient, and has just come through Door of Hope and is now actually giving back to the community through Door of Hope. There's a story after story in the packets I gave out. There's another story about both myself and another family that lives here in Glendale that has come through our program. We have numerous success stories. We're just asking, I know that you have a very difficult time ahead of you to decide on the funding. We ask for substantial funding. We recognize that every year we get a very small part of what we ask for, and we stretch every dollar. I know you don't have a lot. We'd love to have more, but we will match, as historically, one of the weaknesses that were mentioned, historically we've matched up to 5 times of the funding, over 5 times the funding of what you've allocated in the past. And so with that, I want to thank you for partnering with us, making a difference in the lives of homeless families, not just now, but also a legacy of generations that will be impacted by your partnership with us to be able to help homeless families and children. Thank you so much. I'm open to questions.
Questions? Mr. Olivares?
Yeah, a couple of questions. On your application, you talk about a donation from somebody that obviously we don't want to know the name, but can you give us some idea what that amount might be and what the organization might be, or just generally speaking?
We receive funding from numerous funding sources, some government, some private foundations, individual donors, churches, a lot of different agencies. I'm not sure which specific funding you're referring to, but we do match. Our match dollars are private funding, and private funding comes from either private foundations or individuals.
And then could you give us some idea of the percentages of ethnicity of the persons you serve?
Yeah, I don't have the statistics or data in front of me, but it is something that we do report regularly to the city, and it is actually, I don't have that data with me. It's reflective of a very diverse population, including reflective of the community that we serve.
And I guess that's the question. Does it reflect our ethnic groups, of which we have many here?
Yes, yes, it does.
Course.
Yes.
So in your eyes, you see it being balanced out amongst the different ethnic groups?
Yes, I do see that. I think, sadly, there are certain ethnicities that are a little bit more impacted by domestic violence and homelessness, and so it varies from time to time.
Okay. And if you can bear with me a second, I want to ask the lady, and I forget her name. I apologize. A question.
Okay.
I'm somewhat familiar with situations like yours, and I know what they do. My question to you is, where do you see yourself 2 years from now?
I actually am nearing my graduation date. I am looking for permanent housing now, and in 2 years, what I hope to see is, I know that we will have permanent housing. I see myself working full-time. Employment is still one of my biggest challenges, and I actually have benefited from receiving assistance from HUD as well. That's how I'm looking for permanent housing. And something that has sort of come out of this for me is a real drive and passion to advocate for this group of people. And I really see myself giving back in some capacity. I don't know how that looks right now, but I can tell you that I feel very driven about it and very passionate about it.
Thank you.
I have a question.
Yes, Mr. Tushin.
Yes, thank you, Mr. Chair. Mr. Peters, obviously, we're all very familiar with your program. You ran some statistics by that I probably missed, but I wanted to ask you, do you know the number of homeless single mothers and children who have been through some sort of domestic violence in some form in the city of Glendale in the past year?
We just completed a homeless count, which has not released the numbers yet, so we don't have that number available. I do have, I don't have it actually with me. I know that the 52, in 2014, 45% of the homeless population were families. A majority of that was domestic violence. I don't have that statistic in front of me.
I seem to
We do have
recall
that
from
available,
last
though.
year, we were around 400 in terms of homeless population, but I don't know if that's still the case. Mr. Carrillo?
Mr. Chair, members of committees, if you wouldn't mind, I would like to bring up Yvette Sembillion, our homeless coordinator, because I know you'll actually be seeing several homeless projects, and she can kind of give the number that of persons that are homeless.
You're with the city,
percent.
obviously.
She's with the city.
Yes, Chair Armenian, members of the CDBG Commission, Mr. Carrillo, staff, my name is Yvette Samvalian. The homeless count is conducted on a biannual basis. We just completed our 2015 homeless count, and the information and report will be released in March. We would come back to you in the future. However, based on our 2013 homeless count, we had identified 320 unduplicated homeless persons in the city of Glendale. Of the 320, we had 120 sheltered homeless, and of those shelters, we had 40 individuals that were survivors of domestic violence or members of families that were survivors of domestic violence receiving services from Door of Hope. Based on the 320, about 15% of the population is a survivor of domestic violence in the community. And to address it in terms of ethnicities, we are serving all the ethnicities because domestic violence happens in all communities, and so women are typically served in our programming that are safe and from the referring agencies to make sure that their safety maintains in our programming.
I guess if I could ask a follow-up question, because I think the reason for Commissioner Olivares' question is there's no doubt there's probably domestic violence with every group. I think part of the question has also to do with how do we reach all those groups, because there's different dynamics and nuances, cultural nuances to each group. How do we make sure that we are making these programs and services available to everyone? So that's, I guess, both a question for you as well as specifically with Mr. Peters' program.
The Door of Hope Transitional Housing provides materials, marketing materials in various languages that's distributed within the city of Glendale and other organizations, coordinating with our YWCA of Glendale, who is the lead domestic violence service providers. And so, for example, if we have a family that is a survivor or a victim of domestic violence from the city of Glendale, if the batterer is in the community and there is a threat at the moment, the family is referred out to our network programming. And so we ensure safety of our women and their children who are experiencing domestic violence. But it is translated in different languages, and services are available for everyone who is a victim of domestic violence to be in a program that's safe, that Door of Hope provides.
And I assume there's close working relationship with law enforcement, who is probably on the front line of this issue.
That is correct, Mr. Armenian. The safety of the programming is secure. Locations are secure. Families have to sign in and sign out of the programming. There's different program requirements. If you need specifics, I may have to relate to Mr. Peters to provide to you. However, yes, we do work closely with the police department regarding safety measures.
Question, is income a consideration?
In terms of entry to the program, no. The case managers work with the families to receive or access mainstream resources, and then work with the families to obtain employment prior to graduating from the transitional housing into permanent housing, as they would require to sustain their housing in the future.
And Mr. Chair, if I may be permitted, just one follow-up question, and I don't know if Mr. Peters wants to answer this one, but of the numbers that you had mentioned, how many of those single mothers and children actually walked through the door of the Door of Hope in the past year?
We're probably
Chair Tashchi and members of the CDBG Commission, Vice Chair, I apologize. Door of Hope served 18 families last year, and so throughout the entire year, it was 18 families that comprised of about 66 persons, including their children. And as of right now, I believe there is a report for the commission, and they've served already 17 families.
So is it correct to assume we will get a report, the city's report on the population, the breakdown, who's serving what constituencies, et cetera? Did I hear that correctly?
Yes, Mr. Chair, we will forward you a copy of the report once it's finalized on the numbers of
Okay. Thank you.
that reported. But I know we're a little bit behind schedule here.
Other questions from commissioners?
I just have one question. I'm familiar with your work, very valuable program in our community, and I commend you and your compassionate staff. Have you seen an influx of an increase in migration for homeless individuals to our community? We sure see this at our hospitals and our emergency rooms from outside our community moving in. So it's more like an in-migration. And how are we serving those? Are we serving those? And
Committee Member Markarian, members of the CDBG Commission, The 2015 homeless count, without releasing information as it is not final, is we are seeing less homeless individuals in our community, and we're aware of the situation with the hospitals, and the hospital did participate in the homeless count, and we're working with the hospital on addressing the needs of folks being discharged from the hospitals.
I have one final question, and that is, I know you run the facility in Glendale, but you also run it in other cities. How many total operations do you have as an organization?
Yes, that is correct. We actually have 3 locations, 3 sites, 2 in Pasadena and 1 here in Glendale.
Other questions?
No, I think
No questions, but
Okay.
a comment. I think we're all very familiar with your work, and I believe it serves a great community need, and I support you 100%, and I'm sure all of us support you 100%, Mr. Peters.
Thank you very much.
Thank you very much.
Okay, next, Glendale Healthy Kids.
Good morning. I'm Sharon Townsend with Glendale Healthy Kids, and I apologize the response is not in your packet as I was on vacation during the request and at the deadline, but I've hoped to answer that in my synopsis this morning. Glendale Healthy Kids is requesting $30,000 to promote preventative health by using our network of volunteer health care providers. For the past 21 years, we have met the unmet healthcare needs by providing a safety network for children, working with the Glendale Unified School District's nurses, health clerks, parish nurses, and agency healthcare professionals in identifying needy children who are underinsured and uninsured. We have provided them at no cost quality medical, dental, mental health, and vision services. Our collaboration with Glendale Adventist Medical Center, Glendale Memorial, USC Verdugo Hills Medical Center has allowed our children to use hospital services such as surgical units, therapy, scanning, and additional services as needed, again, at no cost to these families. Our mission has always been to ensure that children have access to health care. Next week, for example, a 4-year-old girl with a cavity in every single tooth will be in the hospital at USC Verdugo Hills Hospital as she needs an IV sedation and cannot have that done in a normal dental situation. The city's needs assessment identifies those uninsured and underinsured children of the working poor, in particular, were identified as unable to see physicians and specialists, and it does seriously limit their preventative care and even routine health maintenance. These families, even with the Affordable Health Care Act, are going to continue to be unable to get health insurance, even with subsidies. When a parent has to choose between paying for a subsidy, receiving a subsidy, or paying for health insurance policy or feeding their family, they're going to feed their family. Also, they're unable to navigate that system in addition to being cut to part-time by employees in order to avoid paying health insurance. We know that the majority of covered California does not provide dental and vision services, which is a great bulk of our services to the community. And we're not even talking about the large immigrant population that we do serve, such as the large Syrian influx that came into Glendale last year that the hospitals and Glendale Healthy Kids helped. The Glendale Healthy Kids service area includes Glendale, the surrounding communities of Montrose, La Crescenta, Sunland, Tujunga. Our offices are physically located in the YWCA building, and we service nearly all of the Head Start preschool children. While most medical needs are met in Glendale due to the lack of pediatric beds in Glendale, we do have instances that we have to take our children to Children's Hospital, and we have a wonderful working relationship to them. The majority of our students are from the identified low census tract, which includes Roosevelt Middle School, Mann, Muir, Edison, and Cerritos elementary schools, though we know that the uninsured and underinsured do not have a zip code. Our goals are very simple: to provide health services to a minimum of 500 children, returning them to school healthy in a minimal amount of time, providing them a medical and a dental home, and to provide 150 children with basic oral health screenings, cleanings, and sealants through our Give Kids a Smile program. We do a Give Kids a Smile all year instead of a Give Kids a Smile once a day. Participants are identified by the school nurses, health aides, parish nurses, and agency health professionals and our community partners. We service and collaborate with every one of the nonprofits in this room: the Door of Hope, the YWCA, YMCA, Ascensia Head Start, and the Salvation Army. Eligibility is determined when our clients fill out our financial screening forms, which have been aligned to meet the federal financial eligibility requirements. We do have a comprehensive process and outcomes evaluations, which does provide qualitative and quantitative data, including client demographics, participation, attendance, and key accomplishments. Our records are medical records bound by HIPAA, and they are case managed from the beginning to the end. Our collection strategies and data collection include but are not limited to intake assessments and surveys, and this is intended to assist with program adjustments and maximize the quality of services offered to the students in the community. Our program outcomes do measure the success of the programs by qualitative and quantitative means. We have healthy children returning to school. We have children that can smile because their teeth are straight, and a child with suicidal ideations being treated properly by mental health experts in the amount of time that they need, not limited to the 8 sessions provided by insurance, is success to us. We know that 40% of children in the school district are Armenian, 23.13 Hispanic, 18.77 Asian, 1.33 Alaskan, and on. And we know that the poverty level in Glendale is 14.2%, and females constitute over 52% of that. In the economically disadvantaged areas of the community, majority of our children, 58.4%, are living in homes with income levels less than the 200% of the federal poverty level. And that 13,480 students, that's 45.5%, do participate in the federal lunch program. These are most of our kids. In Glendale alone, in our service area, 26.4% of children have some form of Medi-Cal, and 6,873 are enrolled in healthy families. We have a lot of poverty in Glendale. We are 4% higher than Burbank. We are 2% higher than our neighboring city, Pasadena. There's a lot of pockets in this district that a lot of us do not drive by. And I encourage you to help us to continue to provide services for these families that need it, and will continue to be uninsured and underinsured. Thank you.
Questions? Yes.
Hi, Sharon.
Hi.
You guys are doing a great job.
Thank you.
Such a great program. As far as mental health, do you have volunteers that can support that program?
We do. Just a real quick, Senator Liu identified us, and we have been working with Senator Liu for the past year and have formed a mental health coalition, which began in September. We have been meeting monthly. We have gathered all the mental health providers and experts in the field. There's about 50 of us, including the city of Glendale. Scott Ochoa has been very instrumental of this. And together we are working to create this network, a bigger network of providers. We reach out to all our providers. They do it on a volunteer basis. We are working very closely with Dr. Cerati, the head of psych and psychology at UCLA, a top expert in the field. And extending that network of providers. We have worked closely with the school district and the city in dealing with the suicidal ideations taking place in the city, particularly in the CV school region. We have seen, unfortunately, a large increase in the need for mental health providers. Some of that is due because, as you well know, insurance, even in covered California, has some mental health provision, which is better than it did before, but they only allow 8 sessions. And we know that someone suffering from mental health or suicidal ideations needs a lot more than 8 sessions.
Thank you. And that was my second question with the new reform and the
Yes.
So, but there are limitations to
Yes.
what they can offer.
Yes, absolutely.
Thank you.
Questions?
I don't have questions, too many, actually. I'm very familiar with your program.
Thank you.
I think it's, in terms of outcomes and all the weaknesses here, they don't really stand out for me because you're so visible in the community.
Thank you.
In the work that you do, and because you work with the schools, I think your collaboration is just outstanding. I just had a question on how you serve Tahunga and is it Sunland?
We serve Tahunga and Sunland. Everybody knows who we are. They pick up the phone. They have a child in need. A lot of the Syrian population that came in did move in the Sunland Tahunga area. and either directly from the hospitals. I know Memorial and Adventist had a large percentage of them, and some of the worst health care needs we've ever seen, and they referred to us, and we refer them out. But we case manage them from beginning to end. Our end absolutely case manages. We have 80 open cases right now, for example, and we've had 26 new cases in this past month.
And then your dental clinic is with USC?
No, it's not. It's actually with a volunteer. We used to bring in the USC dental van, and we do not do that any longer because we found that was terrific. You would get that dental home once a year, but what would happen to it? Where would the kids go when they needed the follow-up? So we stopped doing that, and we now have probably 100 dentists in the area that we refer them to.
Yeah. And what's your association with UCLA? Is the
UCLA, Dr. Zarate is on the Mental Health Coalition. He also, his wife, Dr. Kathleen Dennis Zarate, is the head of ophthalmology at Memorial Hospital, and she is also one of our providers.
Mr. Chairman,
yeah.
thank you very much. I have a couple of questions.
Yes.
My first question is, how are you providing funding at the present time with respect to access to health care for uninsured and underinsured children? And then the second question is, why were you not able to provide the staff with responses?
I was on vacation, sir. Yeah.
I mean, I know that Chair Armenian also wants a response to that with a response to the weaknesses that were outlined in this report.
I was on vacation when the request came out, and I was on vacation during the time that the request and the deadline came out, and I had hoped to answer your questions in my response today.
And you did.
Thank you.
And with respect to my first question,
we do a lot of grant writing. And so last year, for example, we were able to take in $162,000 in grant funding. We also do a lot of fundraising. We have 3 iconic events, one of them being the Taste of Downtown Glendale. Guess who's coming to dinner? We have donations. We have board requirement donations. And we're out in the community everywhere. And as I say, I'm always looking for money under rocks. Our board members are very committed to fundraising for us as well. We have a wonderful partnerships with the 3 hospitals. We receive grants from Dignity. Adventist also supports us financially. This past month, received a $30,000 donation from Verdugo Hills Hospital. So we have wonderful partnerships with the hospitals that do support us financially.
thank you.
I have a couple of questions. Can you break down what sort of services you provide by a percentage in terms of, is it dental versus eye care versus mental health?
We this past year, we did 526 medical appointments. We did over 4,000 units of education, health education. We're in every single first grade in the school district, providing 3 oral health education classes for them. We are in most of the Head Start preschools in the community, providing healthcare education classes for them. We've long been in the business of preventative health care before it was required by Obamacare, known as the Affordable Health Care Act. We believe that prevention is the key to success, and that's a big portion of the Affordable Health Care Act, and we've been doing that almost since our inception. Being out in the community, out in the school districts, providing dental health classes, oral nutrition classes, asthma education classes. We're at the Door of Hope. We're at the Salvation Army, Ascensia, providing health care classes to them in addition to servicing their medical needs.
So do you have do you have this in a more comprehensive report in terms of what specifics?
Yes, I can give that to you. Yeah, absolutely.
And have you noticed any sort of impact in terms of Obamacare to?
Absolutely. I think the 3 hospital CEOs and I meet on a regular basis talking about, especially previous to the Obamacare and what was going to happen. We have found 2 very large holes, one being the lack of dental and the lack of vision care, so we're still seeing increases in our dental and vision. We also recently found one hole that hasn't been advertised, and that's that by law, you have to cover that employee, but by law, you don't have to cover the family of that employee. So we have families that aren't insured, but maybe the father or the mother's insured.
Okay. My final comment is, although you have provided a lot of information this morning, and I do know about the organization and am thankful that you guys do what you do, I would like to see for the record that you more formally respond to the weaknesses.
I can do that, absolutely.
So that it's on the record. Mr.
And actually, again, I'm familiar with the
Oh,
group,
Lars.
with what you do, but one of the comments that the staff made had to do with your budget narrative and the operational costs associated with $25,000. Could you quickly just talk
I
about
can
that?
tell you exactly what it is. I'll just give you the breakdown. 32% of your funds would go towards case management, 28% towards direct services, which in this case would be prescriptions. Our prescriptions would include such things as vision, glasses, medications, EpiPens, inhalers. 15% will go to printing and program services, and 25% that you're talking about would be the operational cost, which is insurance, communication, accounting, and program supplies such as educational supplies. In our case, they would be educational books, toothpaste, toothbrushes, stuff that we pass out to children in educating them towards good health.
Thank you.
Thank you.
Just an added here. I know you have a large board. How many volunteers do you have?
We probably have about 75 volunteers. I have 20 volunteers just in the dental ed program, and then the other volunteers help us during the year and specifically also at our health festival. We partner with Glendale Community College Nursing and USC Nursing.
Do you still do the education classes in the classrooms?
Yes, we do. Yes.
Thank you very much.
Thank you very much. Thank you.
So next we have the Salvation Army Zone After School Program.
Good morning. Thank
morning.
you so much for the privilege and opportunity to speak to you this morning about the Salvation Army Zone After School Program. We've been operating this program in the city of Glendale.
Your name?
My name is Jessica Sneed, and I also brought with me Rick White, our operations director, who is responsible for writing our proposal.
Thank you.
We've been blessed to operate this program in the city of Glendale since 2006. And while we've been operating for 9 years, we do strive every year to add new components and services to the children that we serve through this program. The Glendale Zone Academy serves kids in grades 3 through 8 from Glendale Unified School District, although we do not limit our services solely to the city of Glendale. We do serve children in the Los Angeles area and other areas as well. Our programs are provided free of charge. The after-school program is one of the few free after-school programs in the city of Glendale, and we serve kids mainly from Edison Elementary, John Muir, and Cerritos, although also from the middle schools in Glendale. We serve on average 25 to 45 children a day. Although our enrollment is over 70, not all of our children are able to attend on a regular basis because of different causes that limit their transportation within their family of origin, whether it be transportation and other things like that, of that nature. A regular day for our kids includes homework help and a healthy snack, education, and recreation in our gymnasium. We're blessed once again to be offering the Let's Go Learn online reading assessment program, which we see our children improve in a grade level with their reading comprehension every year. Over 50% of our kids who participate in that program will improve their reading level by a grade level throughout the course of that program. We're fortunate to have collaboration with Glendale Healthy Kids, where a dyslexia class and reading class is taught by one of the staff members from Glendale Healthy Kids. In addition to that, I'd like to tell you the names of 3 children who are marked success stories of the Zone After School Academy. Since the Academy has been operating for 9 years, we now have children who started in the Academy at 3rd grade who are now college attendees and high school graduates. One's name is Giselle. Giselle was an attendee at the Zone program from 3rd to 8th grade, and then through high school she was a volunteer in the program. She's now attending Fresno State University and credits the Zone program with teaching her the study skills and work habits necessary to be successful in high school and at college. She was fortunate enough to receive scholarships from the La Crescenta Women's Club, the Glendale Latino Association, and the Gonzalez Harris Award from the city last year. She's attending Fresno State now and is loving attending university. She's the first person in her family to attend college. Enrique is a student who currently in Glendale High, who was a zone after-school participant from 3rd through 8th grade and now is a consistent volunteer on a weekly basis. He graduated the zone after-school program and has aged out. He's no longer young enough to attend, but the program made such an impact on his life that he volunteers on a weekly basis to help kids with homework and recreational time. Additionally, we have an amazing young lady named Ileana who's in the 6th grade this year. When Ileana first came to us, she was failing almost all of her classes, and she was using her powerful voice to bully and intimidate other students. Now all of her grades are above a B-level average, and she's using her voice to encourage those who need encouragement rather than bullying. Her work habits have improved drastically. She's completing her homework on a daily basis, and we're thrilled to see her see success because of the skills that she's learned. Finally, one of the most exciting things that we're offering in just the past year is a Speakers Bureau program where we have local leaders come and speak to the kids who are participating in the zone program about a variety of subjects. We've had a member of the Glendale Police Department speak to the children on bullying. We've had a member of the Glendale Police Department and the K-9 unit come and do a demonstration for our kids. Attorney from the Glendale City's Attorney's Office came and gave her story of success in the city of Glendale and the work that she did to get to where she is in our city, as well as members of the fire department and police department come and volunteer, as well as speak to our kids. We love to show our children Glendale success stories, people who have succeeded in this city through hard work, and be able to show kids success stories from the city, from the neighborhoods they grew up in, people who are now successful members of society. It's a great privilege to work with these kids on a daily basis. It's messy and loud and hard to see difficult things happen to them, but we believe that we're making a difference every day. And I'll take any questions.
Questions? I have a couple questions. Do you have a breakdown of ethnicity in terms of who comes through your program?
We see many different ethnicities. The majority of our kids are Latino. We also have children of Armenian descent, African American. We have Caucasian families. We really kind of run the gamut, and it's fairly consistent with the census data for our area.
Do you have that do you have that specific statistics on that?
Rick, do we have specific
Not necessarily
statistics?
for today, but if you could provide that to staff, or maybe if staff already knows.
We can ensure that detail gets to the board.
I think it'd be important just so that we know we're serving everyone.
Excuse
Mr.
me.
Correa.
Mr. Chair, that kind of data we do have from our department. We collect quarterly reports from the agencies, and those would give us the data that if you like, again, for future reference, the data. Now, the data that was collected is based on racial categories. It will show white, African American, Hispanic, Pacific Asian. Armenian is not a race in that category, so you wouldn't get the exact breakdowns of our unique cultural groups here in Glendale. But it'll be breakdown of the major racial categories of the agencies.
Is it possible for us to gather that sort of data? What are the rules around that?
The HUD rules only require us to collect data based on
I
the
recognize
race.
that, yeah.
So that would be an extra
For
step.
our own purposes.
Correct.
Because I think that would be helpful in directing program, and it's not about. I'm not questioning the motives here. What I'm questioning, the reason I'm asking for those things, it points to whether or not our outreach is effective. Every cultural group has different sort of barriers to this sort of stuff, and so how can we, help the agencies be more effective through partnerships with different organizations and different channels into those particular, unique demographics of our community. I think it would be an important thing to consider for moving forward, separate from the HUD reporting requirements and tracking requirements. That's the only reason I ask.
Yes, there are always going to be agencies, based on their location and the type of service that will attract one ethnicity more than the other. But that'll be great information to review. But I am familiar with your work. It's a great service to our community and to children. And if I may ask a question around
Please.
You said you're serving 70 unduplicated youth every year. So what happens to the 70? Do they move to the next year? They stay with you, or they graduate and you receive new students or new members?
We do have some kids move out of the area on a fairly regular basis. We do tend, once a child is consistent in the zone, they tend to stay for the duration of their eligibility. And we often see siblings or family members of other children who have heard about the zone program from their family then come to attend. However, we do also have new children come every year, all throughout the year. We don't close our registration. So like just this year, just in the past month, we've had 2 new children begin to attend the program who heard about it from the counselor at their local elementary school. So does that help to answer your question?
Every year, including the new and previous years, is over 100?
I could estimate that, but I don't. I would have to look at the data to ensure that that's accurate.
Thank you.
Final question. You may have said this, maybe I missed it. So how do people feed into the program? What's your outreach? How do you do your outreach?
Our after-school program director works directly with the counselors at the local schools surrounding our location. She provides them with up-to-date flyers every year, and they specifically have her name and extension, so she's on the phone with them fairly regularly, referring children out to receiving referrals from counselors for our program. We also advertise through our housing programs and our social services and food pantry program to ensure that the families who are coming to us for other needs may find out that we have another program that will meet a different need of theirs.
Do you have in-language materials for those? Because you mentioned most of your come from non-English speaking
We have
households.
Spanish and English materials readily available. I don't know that we have other languages readily translated. Yep, go ahead.
Good morning, Mr. Chairman and CDBG Committee. My name is Rick White. I'm the Director of Operations. And one of the partnerships I wanted to bring to the board is fairly recent. So it's not included in the RFP. It's not included in the materials that we've given to you. But our housing case manager, Shavana Parker, has begun to work very closely with Pacific Clinics. In fact, yesterday she was there doing life skills classes on budgeting for their participants, for the parents that are involved in their program. We expect that this new partnership is going to increase our outreach out of our census tract, where most of our kids come from, into the greater city of Glendale.
So, I would encourage you to consider additional languages, because we have such a large populations of other ethnicities, Korean, Armenian, et cetera, that I know you can't do them all, but certainly there's more than just Spanish speaking. And since you're dealing with primarily a population of non-English speaking, if you don't have it in that language, then you're going to automatically, there's automatically going to be a barrier to people benefiting from your very good program.
Absolutely. We'll take that under advisement.
Okay, thank you.
Just to follow up on that, are your clients necessarily non-English speaking? I mean, they may come from another.
No, not
background.
necessarily.
Yeah.
Many of our clients' parents, many of our participants' parents do speak English, and many don't. So we do have both.
You have both. And then on your on the 70 unduplicated youth, do you have an idea, maybe a number more or less of the latchkey kids?
Latchkey meaning their parents are working, and
Whatever you call latchkey.
I would say most all of our kids are latchkey kids.
Are they? Because it says an annual many. So is that pretty much most then?
Yes. Many of our kids, would you like to add?
Yes.
Go ahead.
It's hard to quantify what latchkey means, because a lot of the children we have, their family situation is fluid, and they may not technically be home alone, but often they're home with grandparents who are shut-ins themselves and invalids. Though that wouldn't fit the traditional category of latchkey, we consider that because they're at home, they're unsupervised. We have many 8-year-olds that are being watched by their 10-year-old brother and sisters. We know that's not legal or safe, but as Dora Hope mentioned and Mia earlier, employment and childcare are the two most difficult areas for any single parent, especially in the city of Glendale, to take care of. And once the parents get work, they will do whatever it takes to maintain their employment. Often the children end up as a problem that is secondary to maintaining employment.
And your location is in
our census tract and in our program.
As required.
The HUD requirement is that we serve low-income families. Mm-hmm. The vast majority of our families would be considered very low income, and though we have never turned away a child from any income area, that's not our criteria. Mm-hmm. Our criteria is, do you need help, and can we help you?
In this census tract?
Anywhere. Though dealing with the population we deal with, most of our kids walk in. Very few of them are dropped off. Mm-hmm. And so there is a geographical restriction for where we are. We're almost in the very southern part of Glendale, and that tends to be out of walking distance, especially when you have the high traffic areas of Colorado and Broadway. Parents would rather keep their kids close to home than send them out into those types of situations.
Thank you.
Thank you.
Thank you.
Chair Armenian, members of the committee, I just wanted to once again remind you to fill out your evaluation forms for each.
Oh, we're doing it.
Okay, great. And also an observation that we're still running over half an hour late.
Yes. So next, I'd like to call up the GIFT program expansion. Glendale Individual and Family Treatment is what that stands for. All for health, health for all.
Good morning, distinguished ladies and gentlemen. Thank you very much for the opportunity for inviting us to speak. My name is Alan Azizian. I'm a psychologist, and I've been involved with the program in terms of the developmental and delivery of psychological services. I have my formal response in here. May I actually pass that around? Would that be okay? As it was mentioned earlier, All for Health, Health for All Community Health Center is a California nonprofit public benefit corporation. It has 7 locations throughout the city of Glendale, Burbank, and Sunland. It's been serving the community for over 20 years, providing primary care services to community regardless of the ability to pay. The GIFT branch is a new innovation of this center. It was the brainchild of a remarkable human being, educator, physician by the name of Arthur Bogosian, who was a psychiatrist, and unfortunately he passed away prior to seeing the operations of the clinic. The clinic has been in operation since July of 2014. During this time period, it has served 91 patients, providing multidisciplinary diagnostic and treatment services for a variety of conditions, including but not limited to individual counseling, family therapy, group psychotherapy, as well as educational classes, psychological and educational testing, support groups, social skills training, and different workshops, crisis management, and different types of psychological interventions. The aim of the program, Dr. Progosian's vision was to create a program to reach teenagers. And the purpose for this was that he always envisioned that mental health impacts people in their vulnerable time periods of their development, in which they're the most sensitive in terms of acquiring information, as well as impacting people at a time period in which they're at the peak of their most constructive area of their lifespan. The program has been providing different types of psychological services. Currently, we are operating with minimum resources, And the people that we have had in there that have all either volunteered or providing their services are, again, people that Dr. Pagosian had brought collectively to really to be able to provide people, especially teenagers, with a moral compass in terms of juvenile delinquencies and those types of behaviors. That's it.
Okay. Questions? Mr. Olivars.
Thank you for presenting. You've been at this Cedar House now a couple of years?
Since July of 2014.
Yeah, okay. Because I know there was a previous program there that provided similar services, if I recall correctly, and I think it was on your proposal, you're picking up for a program that's no longer there.
Isn't that a city program?
It used to be a city program.
Used to be a city
Yeah,
program.
I'm personally not familiar with the previous program that was in place.
Mr. Carrillo, am I correct in that? I am, right? Okay. And thank you for the updated answers to the report, because that was one of the larger questions, and maybe you can speak briefly to it, to how you intend to spend if you were awarded $50,000. Exactly what would you do with that? Those funds.
How we would like to spend that if we were awarded. As I mentioned, we are really operating in limited resources. We have only one full-time clinician who works there 1 day a week. There's a great demand in the community. And people, historically, people have always went to mental health services at the last time phrase when they were no longer functional. Things have changed dramatically, and there are many people in the community that are acquiring mental health services, not that there's something necessarily that's wrong with them, but they want to enrich their lives. They want to foster well-being. That funding will allow us to, first of all, to have more staff available. Currently, majority of the people, I should say more than 95% of people who have been seen there since July, the 91 people that I mentioned, they're from Armenian descent. And the reason for that is, again, we have only our primary care people who are over there, they're Armenian speakers, and we're unable to have an outreach to the overall community. So it will provide us with the resources to be able to have a more enriched program to provide services to the overall residents of Glendale.
So primarily you'll be using it for payroll for your counselors?
One aspect, yes. Yeah, primary for that, yeah.
Thank you.
Other questions? Yes.
Thank you. I am familiar with All for Health, Health for All. Dr. Janoyan did an excellent job. And this valuable service, I can't tell you how grateful our community is for all your locations and the services that you have provided for many years for underinsured and uninsured individuals in our community. Just working at a hospital, and I can tell that the services have been extremely important to our community, and many have benefited. And this is a very new aspect and a complement to the services currently available. My question is, wouldn't some of these services be covered under Medicare, Medi-Cal, or some of the insurances that, or under Obamacare, and just what would be, and this funding, if you do not receive the complete funding, how would you supplement the remainder to get this program moving forward?
Yeah. If I can defer that question to our CEO so we could speak more clearly with that.
Hello, I'm Adrina Ibrahimian. I'm the president and the CFO of All for Health, Health for All. As you may know, we as a federally qualified health center receive many grants and are contracted with the County of Los Angeles and with the state and federal government. Under different programs, we receive funding that have their specific purpose. And these funds are supposed to be used for their specific purpose. As a federally qualified health center, we receive funding from HRSA and Bureau of Primary Health Care, and that fund is supposed to allow us to reach to the uninsured population that that are self-pay, and we put them on a sliding fee scale and discount their services. But that is again, that has its own purpose, and that is mainly provided for primary health services. So mental health is a new branch, and we do try to use the funding as much as we can possibly use for primary health and some mental health, but to be able to fully help those patients in mental and behavioral health, we do need the additional support because we don't have any funding coming just for mental and behavioral health.
From the federal?
From the federal, state, and the county.
Okay.
Other questions?
I have a question.
Question.
Thank you, Mr. Chair. Are you familiar with any other agencies or any other organizations that provide similar services to the one that you're requesting right now for GIFT?
Yes, we definitely are, and we try to collaborate with them. We collaborate with, for example, Pacific Clinics, D.D. Hirsch, ARC Family Center, and other programs that have similar motives. And up until now, the All for Health Healthful Community Health Center would always refer those patients out to, those similar programs that we've been collaborating with up until now. We did realize that it makes more sense. It is obviously to integrate the service and provide it internally. So we still collaborate with them, and we still refer patients to them for more acute care. But we do try to, with limited funding, we do try to provide at least the most basic
So how does your program, the SCIF program, stand out differently than some of the other programs that you just mentioned?
I'll let Astrid or Alan answer that.
As I pointed out, one of the main contributions of Dr. Bogosian was not only just focus on the deficits that people have in the mental health services. People often seek psychiatric services for problems that they're having, but there's also another way of looking at this, to even empower that which is good in people. So that's one of the unique aspects of it, which is based on positive psychology. The other aspect of it was to provide educational seminars. The center we have already offered a number of them, and I have some announcements, flyers that, if that's okay, I can pass around. And that's another element of it. And then having a more multidisciplinary perspective, which are often not provided in different types of clinics, diagnostic testing, psychological testing. Those are some of the unique elements of this clinic.
So those are the unique aspects that differentiate your clinic from some of the other clinics that you've mentioned that provide similar services. Is that what you're saying?
Correct, yes.
I have no further questions. Thank you.
And if I may add, the fact that the services this specific service is integrated with primary health care makes a big difference. Other organizations with similar motive would have to refer their patients to primary care for primary care services. And collaborating with agencies such as Pacific Clinics or D.D. Hirsch, we would always try to at least get together the two providers from from primary health and from mental health to get together, weekly or monthly on a monthly basis. But when we do have the service integrated, in one place, it is easier. The patient's care is better managed. So we use the same exact software in all 7 of our locations. So the mental health provider is able to also, see the patient's medical record from the primary care provider and vice versa. So the patient's care is also better managed because everything is integrated in one place.
I have a question. So is this mental health component a new component to your service?
Yes, it is. Mm-hmm.
So if I may just ask, so from those 7 clinics, once they see the primary and they get diagnosed with some mental health issues or then they would be referred to this one clinic, which would be the base for the mental health. So you would already have some patients base that are being referred elsewhere
will now be referred to this center, and we will have new patients that will walk into this center and won't have primary health care providers. So we would refer them also to our primary care providers who would, serve their needs in that area.
I have just a couple quick questions. So looking through your financial records, it shows, at least for your 2012 numbers, about 50% of your wages, approximately $2 million, 50% of your budget, $2 million approximately going to wages. How many employees is that?
We have about 70 employees currently.
Okay.
You have a lot of physicians too.
Yes.
So I think if
of them, 15, 16 of them are physicians. Well, just providers, physicians, nurse practitioners, and physician assistants.
Professionals.
Mm-hmm.
Okay. And then you mentioned that your primary patient base is Armenian this time?
Not necessarily only Armenians. About, I would say 50% is Armenian. And I don't have the statistics, unfortunately. I think we did provide it in the grant application. But used to be the majority of our Armenians used to be the majority of our patient populations. But thanks to all the county programs and other programs and grant funding, we were able to outreach to the greater Los Angeles and increase the number of our patients and with different demographics too. Initially, the organization's mission was to provide care for Armenians and immigrants coming into Glendale specifically, but we were able to expand and reach out to more patients.
Cedar House is located in which census tract?
Is it
Central?
Yeah, it's on Cedar and Harvard.
Yeah, come remember, it's a central census tract. I believe it starts up at Cedar, Harvard, and then goes south.
Mm-hmm.
But I don't exactly.
Okay, all right.
And so can you, because I didn't see it specifically named, there was a portion that talked about, that you do receive funding from other agencies, and you've mentioned a couple of them. Is it possible to get a list of exactly what other government
Definitely.
agencies you receive
We'll
funding?
provide that to you.
That way we can factor that into the...
Definitely.
Other questions?
Thank
Okay.
you.
Thank you very much.
Thank you.
Appreciate it. Okay. Still good to go a little bit longer? Let's keep powering through.
I'm okay with skipping the break.
Okay.
Just keep going.
Do need an ergo break at some point, but let's keep going since we have people who are waiting. Next, I'd like to invite the after-school tutoring program, Home and Men, Glendale Adorat Chapter.
Good morning.
Good morning.
Chairman Armenian, members of the commission, staff. My name is Armand Gorgorian. Regarding our tutoring program, I hope that you are aware the mission of Humanitman is to provide wholesome and positive programs for children, youth, and families through organized after-school and weekend activities in a family-oriented environment. Humanitman strives to develop a sense of volunteerism, community service, citizenship, teamwork, and leadership skills in order to divert youth away from the negative influences facing them, such as drugs, gangs, and crime. We own our own facility on San Fernando Road with ample space for a wide variety of programs and activities. It is easily accessible. We are requesting a grant in the amount of $27,528 towards the cost of tutoring program for disadvantaged students who attend elementary and middle school in the southern Glendale area. The program will offer tutoring and related forms of academic support free of charge to more than 170 students who are struggling with their academic subjects and who cannot afford to pay for private tutors. Students in the tutoring program will be given 2 assessment tests to assist in tracking their academic progression. The first test will be administered at the beginning of the program so tutors can learn about each student's strengths and weaknesses in the subject they are being tutored in, and the second test will be at the end of the program for comparative purposes.
Questions? Yes.
So, Armin, has anything changed on the program over the years?
Unfortunately, yes, Mr. Ramirez.
Close enough.
I'm not in a good shape today.
Close enough.
The thing is that when I'm not able to get the grant that I'm asking for, we're cutting down on the number of kids that we serve. We applied last year, and we were hoping that with that money we will be serving 170 people, children. We're only serving 64. We were supposed to have not more than 7 children in every class. Now we're up to 10 children, because if we were going to stick to the 7 children, then we would have only 42 kids served. So we are doing the best we can. I am cutting down on when I give the revised budget after you approved, just like last year when you approved $11,000, so I had to give revised budget. I try to cut those areas that we can afford to do it ourselves. So the program is the same. The children are coming in. We sent 3,000 flyers through City of Glendale Unified School District to schools, South Glendale, elementary and middle schools. And we get responses. People want to come and have their children participate in this program. The problem is that when we get to a point, there's no use of having 15 children in a class, because the service will not be right. So I hope that this year at least you will consider to not only to approve the project, but also to approve the proposal that we have submitted regarding the finances.
Can you answer my question? What happens, because if we do the similar budgets, obviously you're going to serve the same amount of kids.
Yes.
I have a question. Any supplemental fundraising to support the rest that it's not approved by CDBG? I mean, have you considered, if there is so much demand for children to participate, fundraising efforts throughout the year just for this specific program?
Commissioner Markarian, as some of you know, our organization has a lot of different events, different programs. We're serving about 2,200 kids on a regular basis each month. And to serve these programs, we have a lot of holes to fill and a lot of fundraisers to do and a lot of donations to receive. So we have not specifically done any fundraising for this program because we have so many different holes that we have to fill.
So
Any other funds that can be allocated, because it just seems such valuable program, and I would hate to turn away kids.
Well, we are allocating already. If you look at the budget, probably about 22% of it is being financed by our own organization, and that does not include some of us that work and we don't get any funds received. Our pay is not in that budget that we have proposed.
Mr. Tashian.
Thank you very much. Thank you. Your program starts towards the end of the year, December of 2014. Is that correct?
Well, the proposal that I have submitted is from November 1st to end of March, five months. But when the budget is being cut or I am being funded less than what I have approved, I'm looking to find that portion of the year that the kids can use the most. I want it to be as close as to closing of the school year so that they will benefit from the tutorial that they are receiving. But from this side, instead of starting November, I started December so that I can drag it until March, end of March. But if I get funded completely, then I will do it from November to end of March.
Okay, but is that the reason why only $1,000 or so were expended from the $11,000 that was allotted last year?
No. It is not that. It's just that the first funds request that I submit only the supplies. The second one that I have submitted already. You're talking about the funds request that I have submitted?
From last year.
Yeah. We have already submitted the second funds request, which includes the first month, the payroll for the first month, and then the utility that is 5% of the cost, and the custodian charges and all that stuff will be on the third fund request.
I think what we have to remember is that these proposals went out last year.
Yeah.
We're preparing them, and in the meantime, obviously, we've had time go by.
I'm not sure if I gave the answer that you were looking for.
Yeah, well, you started touching upon it previously, I think, which is, the funds were allocated earlier in the year, but yet the program this time didn't start till December 1st.
December 1st. So when I submitted the first funds request, which was about $1,250, it included the supply and the postage and all that stuff. There was no specific charge for the tutors and the program manager. On the second funds request that I have submitted, it is already included.
But I think a little bit of question about your rationale as to why you're starting the program, let's say not in September when schools are starting up versus December. I think you answered that earlier about...
Two reasons.
Yeah, go ahead.
First of all, we rely a lot on school district. And if we go earlier, the kids are not really ready for that. But the more important part...
In terms of referrals.
Yes.
Yeah.
The more important part is that we want the class, the tutorial class, be as close as to the end of the school year, so that they will benefit once whatever they're learning in our classes to benefit from that in their school year.
Okay. Other questions?
Go ahead. Finish up.
Go ahead. I'll ask the final.
I just you said you worked with the school district. I didn't see that in your proposal.
Yes, we do. It is there.
It says referrals?
It is there.
So why don't you just answer the question? I mean, answer...
You said you get referrals? Referrals from the school district?
It is in this proposal that I have submitted. It indicates that we work with GUSD. And again, last year, we printed 3,000 flyers, submitted to the city. Marge Rader was the person in charge of that, and they distributed it to the whole... and we indicated that we want it to be in South Glendale area. Schools in
that was part of your outreach, right?
Yes.
Yeah. But in terms of the referrals, you actually get them from the schools?
When they receive those flyers, whoever is interested calls us and comes and fills in the application.
So it would be through the parents, probably?
Yeah,
directly.
With the parents.
So if you didn't get this funding, this is one program you probably wouldn't be able to support?
We won't be able to support yet.
Okay. And we have an outstanding program, I have to tell you. And it's additional programs, so it might be a problem.
How do you source your tutors? Like, how do you make sure you've got quality tutors?
We first hire the manager, which is most of the time, always a college student, and then through that person, we do whoever he or she refers it to us. We do the interviews, and then we decide on who is the best.
The only comment I'll make is that obviously, I'm a believer in the after-school programs, and there's a variety of them with different proposals. The difficulty is that we never have enough money, and so I am concerned, along with, I think, where Commissioner Markarian was going, that if the organizations do not have the ability to supplement the funding to run a program in an anemic way, on just the funds that CDBG is providing, makes it difficult to be successful. So it's something for Home Minutemen to consider. If this program is a priority for them, then we're always going to, I think, be in this situation where there's never as much funds as desired by each of the organizations. So there has to be some sort of complement to those funds from the organization through whatever other sources to make it successful.
I understand your point, and I understand where you're coming from. We've been doing this for a long time, and you check with those kids that have been through the programs, they say, no, it was a very good program and has served the purpose that it was there. Again, I'm mentioning that we are already providing about 22% of the cost, and we're asking for the rest of it, and it will be a pity that those kids will not be able to use this program.
Yeah, and my comments are not a commentary on the quality of the program and the need. Obviously, the need is there. It's just a pity to not be able to provide the program in a manner in which it serves more of that need, I guess is the question. Okay. Thank you very much. Appreciate it.
One final question. How many years would you say CDBG has been working with your program?
This program, I would say, 8 to 10 years.
It's been a long time.
Yes.
Thank you.
Thank you.
Okay. Next, Fair Housing Program, Housing Rights Center.
Good morning, everyone. Thank you so much for having the Housing Rights Center come to present to you again, and I appreciate the opportunity to come before the CDBG Advisory Committee. My name is Chancellor Al-Mansour. I'm the Executive Director of the Housing Rights Center. I've made this presentation before this committee for the last 4 years, I believe, although our program has been receiving this funding to provide fair housing services for several years. We are committed, and we've been committed to serving at least 700 persons with the funding that we've received, 700 Glendale residents with the funding that we received from the City of Glendale. We are already, during this current year, because we received this funding right now, we're already well ahead of that pace, and we will always serve more than the 700 that we are required to serve. Most of our services are general landlord-tenant advice, how to get your security deposit back, how to get repairs made, and so forth. And about 10% of those do end up involving what we find to be some type of illegal discrimination. Most of the times we mediate those cases and resolve them. Many of those end up being reasonable accommodations requests where the tenant is either elderly or disabled and needs to have some type of an accommodation or modification so that they can use their unit. In those circumstances, we generally start with contacting the landlord, providing a letter, seeking medical proof that such accommodation is necessary, and then mediating on behalf of the tenant and for the landlord as well. But I'll entertain any other questions that you may have about our program.
One question of staff. So it said here under weaknesses that financial audit was not submitted?
Yes. Our program is very complicated. We have 26 different contracts with 26 cities and counties, basically every city and county in Los Angeles, including the city of LA and the county of Los Angeles, and they all have very different requirements about what must be in our audit. So to appease everyone, because they all have different requirements, our audits usually end up being completed in mid-March. Definitely by March 31st, which is the White House Office of Management and Budget final deadline. But unfortunately, we have a hard time with the January. The City of Glendale is the only one that imposes a January 1st deadline. Every other city or county is March 31st. So it's
special.
Yes.
Is that because we changed ours to the 6 months?
I see Moises shaking.
Yes, remember that's because our stricter standard, which we discussed earlier. But again, as was mentioned, the other cities have the federal standard, which is the 9 months.
And then this is a program that is required of us. It's in my opinion, number one priority, because I think fair housing is key to a well-functioning community.
Yes, HUD requires all cities and jurisdictions that receive CDBG or home funds to spend those funds to affirmatively further fair housing.
And in terms of your financial, we've always accepted them up until the time that we changed our rules here. So,
yes, it's just as soon as it's completed, I will submit it. But it always ends up being in March as opposed to in January.
So I don't have any problem with that.
Thank you.
You said that 10% of there's discrimination in 10% of your complaints.
We tend to find that tends to be the average. It fluctuates a little bit more, a little bit less.
When you do the mediation, is that just kind of Lack of education, ignorance, not understanding fair housing?
Yes, it's not mediation in the pure sense of when you have a mediator and kind of the official. It's more so that we inform the landlord of what his or her rights, responsibilities are under the fair housing law, give them an opportunity to address it and so forth before we, turn it into a legal matter.
Have you run into any cases where the medical marijuana is a problem?
It's interesting. Not yet. We get a lot of requests from landlords about what they have to do or allow their tenants to do under the law, and we are familiar with what the law provides in terms of the medical documentation that the tenant must have. There's actually laws all about it. How many plants are allowed to grow, the weight of the plants, how it has to be for personal use, not for sale, and so forth. So we're familiar with the laws. We explain the law, but we haven't had a lot of complaints either way. Yeah.
I'm familiar with the program.
Thank you. Yeah.
No, we have to have it, and you could get by with, how much do we give you? $9,000? That's not too bad.
From this.
Commissioner Olivares.
Yeah, I've known your program for many years, and my question is more general. First of all, I want to say, if you didn't provide this service, the city would be obligated to provide it within the city
itself, city staff, yes.
That needs to be said. We all know what happened to affordable housing funds all over the state the last few years. So there's hardly any funds for senior housing and or disabled housing. Has that impacted your workload in any shape or form?
We're not in the business. I wish we had the funds to provide housing, more so to protect housing.
Rights.
Once it's already
rights,
and to protect rights. But yeah, there's definitely always an impact. Whenever the housing market fluctuates one way or the other, there's always an impact on the rental market. So, for instance, with foreclosures, with all the foreclosures that happened, all those people who either were in homes or would have purchased a home went to the rental market. So that impacted renters who were already in the rental market. It drove rents up, made it harder to find a place to rent, and so forth. And it made affordable housing more scarce, because if you think about all the thousands of families that lost their homes in foreclosure crisis, all of a sudden were looking for some type of affordable housing, because usually it was their financial situation that caused them to lose their homes.
Let me ask the question a little differently. We know there's an existing stock of senior housing, disabled housing. Do you get many cases from those particular tenants or landlords?
We do, not as often. More of the complaints we get are from people who want to live in those buildings, but they're told that they can't get on a waiting list, or they've been on the waiting list for a long time and they suspect that something's going on because it's been years and they haven't heard. So it's more so in the application stage as opposed to the in-place tenants who are complaining about their conditions.
Thank you.
Just a quick question. I know, of course, this is a hard requirement, and we will be supporting, and part of your program is to provide education for the community, and I know last year you had few educational seminars that you held. Moving forward, are you planning on more education, holding more classes and seminars for the community to be able to participate and learn about their rights? How many, you'd say, per year?
Well, we're always looking forward for community outreach. We have 3 full-time staff members, and that's what they do. That's what they're dedicated to doing, is providing the outreach and the education and so forth. We, in our proposal, I know we committed to like one landlord-tenant, one workshop for landlords, one workshop for tenants, and then other workshops as well. One thing I can do to kind of address your question we will do is do more outreach to the other nonprofit organizations to ask them if they want us to come and participate at their events or their workshops and so forth, that we could come and bring materials and flyers so we can take advantage of groups that are already coming together. As you probably know, one of the hardest things is to get community participation, to get people to actually come, especially if they don't have a current issue. If they're not troubleshooting a current problem, oftentimes they're not going to come unless you provide food or dinner or something like that. So, but we can take that opportunity to partner with other agencies.
Because that's also going to eliminate some of the workload. I mean, once they're educated, those unnecessary phone calls, those questions that you can address during those workshops. And I'm sure other agencies would be open to even support you with some of the outreach.
Thank you. And we do. I think that's one reason why numbers consistently go up. in terms of people that we
Thank
serve.
you. Doing a great job.
I think it'd be important to do in-language outreach. I know
Right.
that's a challenge, but the types of people that typically, encounter this sort of discrimination are going to be people who have language barriers. So to the extent that you can focus on that, which leads me to my question. In your report, it says 71% of Glendale clients were white. Can you break that down?
So, as you know, Glendale has a large Armenian population, and HUD census tracts counts Armenians as being white. So that, and actually, the way the HUD census tract works is a lot of people would classify as being white than people would think. My father, I'm from Egyptian background. We technically are considered white because Egyptians are considered white for HUD census purposes. So it actually reaches a whole lot. Same thing with a lot of
Hispanics.
Well, I was about to say same thing with a lot of Latinos. Some of our Latino clients more identify with being white as opposed to having Native American background and so forth. So it's actually more all-encompassing than many people would think, that category.
Mm-hmm. But you don't have a breakdown?
I don't have a breakdown in terms of what the ethnicity is that's white if they don't classify as being Hispanic or Latino. So if they're Russian or I don't have that. We don't ask those questions. We don't get that far. HUD doesn't require it, so
right.
We already have to ask so many questions as it is to screen for
One thing,
eligibility.
I don't know if you were in the room at the time, but one thing we'll be talking about later is about breaking that down so that we can get more accurate about how we're serving our particular population in Glendale. And if you're in 26 cities, I imagine you've got this issue in many other communities where under that white category you may have many different types of ethnicities that are bundled under.
Surprisingly, no other city has asked for us to do that breakdown. The issue that comes up for other cities is more so the other category, who the other is, because under HUD requirements, again, they only ask for race breakdown, which is basically white, African American, Asian, and Native American, and so for Latinos, that's always a more difficult question, is how to identify if they don't identify as.
What is the HUD requirement for Hispanic population?
So in order to, this is the thing.
A particular class.
It's a particular class. It's not race. And the thing that makes it a little bit more complicated under the HUD requirements is if the person identifies as being other, we are required to ask follow-up questions. Well, do you identify as being Latino? And if so, is your background Cuban, Puerto Rican, a Mexican, Chicano, and so forth? So we have to ask those questions. The thing that makes it a little bit more complicated is that if they say, well, my background is a Native American, I'm from Mexico, but my family's Native American, in order for us to categorize them as being Native American, they actually can't just, they have to have the Native American ethnicity, but also they have to have tribal affiliation. They have to actually be participating with...
Or an enrollment somewhere.
Or enrollment with a Native American tribe. And most people who have Native American background aren't affiliated with a tribe.
Yeah.
And so that's the questions I get more so from our cities, is they want more information about that the other category than the current white, African American, Asian categories.
Okay. Thank you.
Mm-hmm. Thank you. Yeah.
Thank you.
Next, I'd like to invite intervention. You want a break?
No, I don't. Not me.
We're a little bit behind. That's why I was going to keep.
Because we're running late.
And we got people waiting. Intervention Prevention Clinical Group Counseling Committee for Armenian Students in Public Schools, CASPS.
Good morning. And thank you for this opportunity to stand before you and answer your questions. I believe most of you are familiar with the program. We've been in existence since 2000.
Your name, please?
My name is Laura Atoyan. I am an 18-year CASPS board member. Mrs. Khambabian is also a CASPS board member, and both of us are directly involved with the program. Unfortunately, our executive director, Arsine Hovanesyan, was unable to attend this morning's interview, so we're filling the gap for her. So the program has been in existence since the year 2000 and has been funded consecutively since 2004 by the CDBG. We had 1 year of hiatus, and then it was resumed. We serve elementary school children in trying to redirect their behavior issues. The goal of the program is mainly academic responsibility and social skills development. and the children are referred to us by their teachers and the administrators. There is an admission process which involves talking to the parents, the teachers, the administrators, doing pre-tests, and beginning to work with the children. The standard length of the program is 30 weeks of therapy at the rate of 1 hour per week during school hours, on site, where the psychologist and her staff visit the classroom and work directly with kids who do play, create, talk activities, and learn to behave themselves, stop being violent, talk to each other in a respectful manner, share, clean up together, eat snacks, have juice, and basically become acceptable in their behavior in the regular classroom. So once they go back to the regular classroom and they transfer what they've learned in the therapy session, we automatically see an improvement in their academic grades and behaviors. And that's basically what the program is all about. It's a pull-out program. They are taken out of their classrooms to go together into a different room. And so there is no issue of transportation for the parents, or there's no issue of language because everything is done in English and everybody is served. We do not serve only Armenian children. And the program is open to all children. As long as they're in elementary school and they're part of the program, they will get the same service. Any questions?
You want to start with me?
Sure.
I'll start with Mr.
Well, of course, you know how I think this is a great, great program.
Thank you.
And you have a weakness kind of outlined here that you might want to address that. I don't really have a concern about that. I think you addressed it to my satisfaction.
Okay.
But I just think the work that you do with the funds that you have is just outstanding, and the funds that you're asking from us is to add an additional school or additional schools, right?
We are asking funding for 3 schools.
Yeah.
And we're waiting and hoping for better funding days.
Sure, okay. Well, I understand completely.
The weaknesses were answered in the letter.
Yeah, right. Mm-hmm.
Yeah. This is about the mileage. We answered it, sorry. We leverage that every year.
And it's, it indicated that just 48% of your requirement for the funding is 48%, which is quite a bit. But considering that you're wanting to add 3 schools, I think that's actually what you do with that amount of money is to commend you. You must have a lot of volunteer hours.
We do. We work very hard on it. We try to keep the program afloat, as I said, waiting and hoping for better funding days. Because we really believe that this program should be in every elementary school, in every school district.
Yeah.
Because this is something I say every year. Forgive me for repeating myself. The impact of the program is not about next year or 2 years down the line. This is about 10 years, 25 years, 30 years down the line. And I think the communities always will be the better for it because we have done this. Of course, what we do is only a drop in the ocean of need, but still, it's worth doing.
Okay. Commissioner Olivares.
Yeah, no, I've known this program for many years, and there was 1 year where I don't know what happened. I'm glad you're back providing the services, but we heard from a program earlier called GIFT. Now, aside from the age difference of the groups you serve, I have to believe, and correct me if I'm wrong, that if you did not address the kids at the age that you're doing now, there's some other ones that end up in a program like GIFT later. Would I be correct in saying that?
But I'm not familiar with that program. What I know is that if we don't do it at the elementary level and be preventive-minded, we will be doing correction later. And so what we're trying to do is nip failure in the bud. And so, really and truly, who's going to lose about that? There's no losing.
Yes, and one other question is, you're asking for the same funding as you did last year.
We've been doing it for years.
Likely it's not going to happen, as we all know the pressures here.
Right.
How did you manage with what you had? Tell us what you did.
We look for deep pockets among our friends, in the community, businesses, in-kind donations of time and talent, real donations of money so we could continue to pay at least for the direct costs of the programs. So, and remember, we have not increased our cost. We have been submitting the same application for more than 10 years now. Even though everything is more expensive than before, we keep leveraging more and more just so we keep it afloat.
Thank you.
Commissioner Markarian.
Just one last question. You're doing a great service to our community. We visited the school that you are providing the service, and I know how supportive the principal was and some of the teachers, so I commend you for that.
Thank you.
Just from previous years, I remember that you mentioned to keep this program at any given school, you need $12,000. Minimum, 12 to 15. So we funded you. How many schools do you have currently?
Right now, only 10, because we can only do one.
Okay, so you have
with
one.
what we get.
All right, so if we were to fund you the same amount as last year, you would continue just with one.
We would do our best to raise funds to do more than one. But the economic situation being what it has been, it's very, very difficult.
Yeah, and we do like to see at least you expand after all this year, many years, to at least the second school.
Yes. Yeah, we talked
And
about this
that's-
last year.
Yes. Anyways, thank you so much.
And
Thank
what,
you very
what
much.
would the second school be?
It would be another elementary school where the principal or the principals have been asking us for services.
Yeah.
And
Which
there have
one
been
would it
many.
be, do you
It would
think?
be Muir maybe, Keppel, R.D. White. They're all asking
The
for
one
it
for
every
this
year.
year that you've been doing is where?
Columbus.
Columbus.
Columbus
At
has been a
Columbus.
mainstay.
Yeah.
We started at Muir, and this was the pilot program, and then we went on to other schools. But funding, as the need grows, unfortunately, funding gets lesser and lesser. So that's the situation we face every year. The need is there.
Of course. Mr. Tashian.
Yes, thank you. I think this is an extremely important program, specifically because it addresses at-risk kids at this age group,
Right.
where it's basically their formative years. So I think it's extremely important. I think that last year, I remember you had mentioned it costs about $14,000 or $15,000 to fund one school.
One school.
That's it. And
That's
you
it.
and you were requesting funding for 3 schools.
Right.
Can you tell me briefly the $15,000 that was allotted to you at last year? How's that been used so far?
Okay, the psychologist alone is $12,000 a year and has been for 10 years. She has not upped her fees because she also is committed to the program.
So that money has been used.
It's done. It's restricted. It's done.
Okay, and for one school, and that would be the Muir School, or was it Columbus?
No, it's Columbus.
That would be Columbus.
And then there are snacks, testing materials, juice, all kinds of other expenses, as you know, to serve 75 kids, to serve as many kids as we have.
Questions? Okay.
And really, the cost per student per hour ends up being $10.53 per hour.
Wow.
Where would you find a trained PhD to work with a student for that price?
Yeah. Well, we appreciate the service to your community. We will
Thank
do
you.
our best to consider your program among all the other programs.
Thank you. We would love to expand to middle school, really, because some of the kids we serve in elementary school leave us, go to middle school, still needing the help.
Okay.
Nothing is completely resolved in 30 weeks for each child.
Certainly.
And in middle school, it would be major to do that.
Mr. Correa, you had something to add?
Yes, thank you, Mr. Chair. Just a quick question, and I noticed in your expense accounting that you have tutoring. Is that part of the program too, or is that separate?
That's a completely separate program with completely different funding and restricted funding.
Is that also at the school, or is that different schools or
That
different?
is GUSD high school students, sophomores who are at risk of failing and not graduating. So the counselors refer them to us, and we do in-home tutoring, one-on-one, while somebody from the family must absolutely be present. So we do have the process of parental consent, commitment, presence, because we don't want any liability, because we send young college kids to these homes to work with the kids one-on-one. And if somebody from the family is not available to be present, we will not do it. So we do it properly. And we have fantastic results.
That's separate from this
Totally
program.
separate, totally separate.
And
That is
how
the
do you
Yes, I
fund,
Can
how do you
program.
fund that part?
Fundraising. Fundraising.
Okay, thank you very much.
Thank you.
Thank you
for your time.
Next, Homeless Prevention Program, Loaves and Fishes, Catholic Charities of Los Angeles.
Good morning. My name is Margaret Pontius, and I'm the Regional Program Director for the San Fernando region of Catholic Charities of Los Angeles. We are requesting $67,098 in funding to fund an existing program, and that will pay for one full-time bilingual English-Spanish experienced coordinator case manager and one half-time client resource coordinator. The program provides case management and social services to poor and low-income individuals and families who are at imminent risk of becoming homeless. The families are primarily at poverty and low-income levels. Many of them are receiving public assistance. Their children are receiving free or reduced price meals at school. The program is offered at the Glendale Community Center, which is located at 4322 San Fernando Road. This Glendale Center has been in existence since 1943, but it has been with the CDBG program since the mid-'80s. The program will serve food and clothing to at least 2,200 unduplicated individuals and case management and supportive services to 60 households. The case management services will include assisting households with job counseling, resume guidance, bus tokens, food, clothing, referrals to other services, information and advocacy calling, interfacing with other organizations. Of the $67,098 that is being requested, $50,959 will be used to pay 100% of the annual salary for the program coordinator case manager, and $16,139 will be used to pay for 50% of the actual annual salary and benefits of the client resource coordinator. The strengths of the program is that they meet the priorities that have been requested of us, including homelessness prevention, case management, and referral to the poor and the low-income residents of the city of Glendale. There's a huge need for this program. The outcomes and the methodologies, the way we measure the outcomes are very clear and very much a part of the program. This program is a vital part of the Glendale Continuum of Care program, and it's active in that committee. And I will turn this over to the case manager, who has actual numbers of services offered if you so request.
Good morning, CDBG committee, ladies and gentlemen. I'm happy to be here in front of you again. And does anybody have any questions that I can answer?
Yes, Mr. Correa.
Same question I've been asking, I guess, of most of the organizations. You're requesting 67,000. Last year, you were approved for 35. How do you manage?
We manage by getting volunteers to help, and also I probably don't get a raise.
Don't either.
I mean, I have to say I've been to your program a number of times. It's amazing what you do, first of all. And seeing the people that go in and out of your place is pretty incredible. Now, you're on the edge of Glendale.
Mm-hmm.
Are most of your clients from Glendale?
Most of them are, yes.
What percentage?
For the Loaves and Fishes program, the Loaves and Fishes program is a large program. The case management is only a part of that, an important part, but we also have a very large food pantry. Last year, we had 1,156 new applications for food. We gave out 3,702 sack lunches. We gave out 544 vouchers to our thrift store for homeless people and low-income people that needed clothing, especially children that needed to go to school. We served 21,724 duplicated people with food, clothing. And because we are part of the continuum of care, we also have access to the other services and the other agencies, and we work together very closely. I do a lot of outreach for Loaves and Fishes to find money to buy food, along with the FEMA money that's continuously cut. I'm registered with Shelter Partnership. I get quarterly deliveries from them for household goods for people that are in apartments that have just gotten into an apartment. Things that they don't have, like bedding, sheets. I have a connection with the St. Vincent de Paul Society that helps them get furniture if they need beds or couches, chairs, at no cost to them, only a small delivery charge. I'm registered with Pets for the Homeless, which is an organization that supports homeless people and low-income people such as seniors, and delivers to me dog and cat food and bird seed every couple of months as they collect it from veterinaries in the center. So this all goes to help. It's a multi-tiered system, and it helps the people that we are helping with the CDBG and the ESG also. It's a big service for them.
Thank you.
You receive funding from other cities?
No.
Just Glendale?
Just Glendale. And the people that I contact, I did receive a very large check to help buy food because of the FEMA money that is cut from a businessman here in Glendale last year of $20,000, which was a big help.
Other questions? Okay. Thank you very much.
Thank you.
Thank you for your time.
Thank you very much.
Thank you. Next, I'd like to invite for Community Outreach Project, Armenian Relief Society of Western USA.
Good morning, CDBG Advisory Committee members and staff. My name is Sonia Zinzalian, and I'm here today on behalf of Armenian Relief Society Social Services. Joining me today is Lena Karagosian, our program coordinator and instructor at the same time. ARS Social Services is requesting CDBG funding in the amount of $66,538 for fiscal year 2015-2016 for our community outreach project. This program is targeted at servicing low moderate income individuals, families, residents in the city of Glendale, primarily immigrants, refugees with language barriers. The request funding will allow our organization to provide the following services. First, Life Skills English as a Second Language classes for 120 senior citizens who will have the opportunity to develop their English language proficiency skills and to receive health and safety practice information. Classes are held twice a week at 2 levels with focus on basic English and safety net services. The second one is individual youth and family counseling for 35 individuals who will receive counseling services from multilingual therapists. The third one, job search assistant for 35 individuals who will receive employment referrals and assistance with resume preparation and job search techniques. As detailed, 190 unduplicated clients will be able to benefit from our vital services, which continue to be of great demand in the community in Glendale. While this project meets the program priorities of employment, ESL senior services, and counseling, I would like to emphasize that beyond these services, our program coordinator offers general social services to meet the needs of over 1,000 individuals in the city of Glendale on an annual basis. With our main office in Glendale, our additional services are of great benefit to Glendale residents. In an effort to highlight the impact of these services, I would like to draw attention to some recent figures from the current fiscal year, 2014-15. In the 6-month period between July 1st to December 31st, 2014, we had 84% completion of rate for our life skill ESL classes and close 50% of individuals receiving job search assistance found employment or have case pending. These success rates are highly indicative of the positive outcomes that result from our services. Our officers receive constant inquiries to enroll in class and seek employment and counseling services. ARS Social Services is committed to a simple guiding principle, that is, to lend a helping hand to those in need, and by doing so, we are able to better their lives and in these circumstances. As a leading organization with vast knowledge regarding our community's need, ARS Social Services is unique in that it offers services in a linguistically and culturally competent manner in order to best serve our clientele. We are proud that our organization is well respected and trusted in the community. Having operated within the City of Glendale CDBG program for decades, and it values, and we work closely with collaboration with the CDBG program and the staff, we humbly request to receive and have it in consideration for our full funding requests in order to continue offering the full scope of our services. This funding remains vital to our operation in the City of Glendale. Please take it in consideration. Thank you very much.
Thank you. Questions?
Sonia, nice to see you again. Has the program changed at all since last year?
Yes, we're having more non-Armenian people from Iraq, people from Syria, that we have people from Egypt,
Who are not Armenian?
They're not Armenians. They speak Arabic language, and the teacher, the instructor, and myself, and other staff members, we speak Arabic too.
So with that change, what is the age demographic? What would you say the bracket is? Are they younger? Are they more middle-aged? Are they older?
We have adults and seniors.
It's mostly the older.
Yeah, adult and seniors, yes. And for employment, it's more adult people, For the classes, it's more seniors, And for the counseling, it's both because there is that generation gap and all this adjustment in the new culture and the new country, It's not easy for them. Like I mentioned in the past, to live a second life in one life, to come not knowing the language, to be acculturated in this environment, And then don't forget they come from a war zone. Yeah. You have to prepare them mentally, before we do anything else. That's why we have the counseling. Even if we want to send them to the job, we have to prepare and tell them what is rules and regulation in America, and then try to find them an entry-level job.
Thank you.
And you provide your services, you have multiple language capabilities,
yes.
Right?
We speak Farsi, we speak Arabic, we speak French, we speak English, Armenian, Russian, and some Spanish too. We have 2 people speaking a Spanish language.
And some of your services, you do receive funding from LA County as well?
Yes, it's different services.
Yeah.
And I have to mention that we have a Chinese caseworker because we're serving the Chinese population too with the refugee program.
I don't have a question, but I just wanted to commend you and congratulate you for
Thank you
all
very
the work
much.
you do and the scope of work, and you always exceed the number of projected, individuals to be served, and you're just doing an amazing job.
Please come and visit us anytime, and you're going to see the waiting list for the ESL classes. It's only one project coordinator and instructor with the amount of money we're getting, and it's, how many people you have in your class? Maybe 80 for 2 classes, imagine.
I have been there and I've seen the seniors,
Yes.
especially how excited they are and how
Yes,
engaged
they
are.
love to
So-
come. It's twice a week, but they're coming,
So are they good students?
Yes.
You're the best students.
They love it, because it's they're learning every day. It's life skill, how to go to the post office, how to go to the bank, how to read their medication, every day is basic
Practical.
English, life skill.
Just want to follow up. Are you still working closely with Catholic Charities?
Yes, we do. With Brenda, we work
provide-
very closely with Catholic Charity. We work closely because we have a refugee program for the other one with JVS that they move in Glendale, and CES, Catholic Charity, everybody that's there in Glendale. Because the population in need, all the refugees asylum are in Glendale.
same, yeah.
So they move to Glendale to serve the population.
And of these new Syrian families that somebody mentioned earlier, have you seen an impact on your program?
Yes.
From those families? It's good that you can help them.
Oh, yeah.
Other questions?
Because they trust us, like I said, they think like we are like a small priest or a lawyer where they can come and share their problems, They feel at home because culture and linguistic, we're there to help them, to tell them where to go, which doctor, they don't know all these things. And then we offer free tokens. For the bus tokens, because they don't have transportation, we get it from ILA. We collaborate with ILA, so we give it to our clients to come to the class, to go to the doctor, or to go to the shopping.
Thank you very much.
Thank you very much. Good luck for you. Bye.
Next, I'd like to. Wow, look at that. We're back on time. Am I
Hey,
good or am I
job.
good?
Very good.
Good.
It's because of everyone's help here. Senior Services Program, City of Glendale Community Services and Parks.
Good morning, Chairman Armenian. I'm Maggie Kavarian, Community Services Supervisor with the City of Glendale Senior Services Program. For 28 years, our program has been serving the most elderly and frail seniors in our community. There are over 41,000 seniors in the City of Glendale, and we serve 60 unduplicated elderly and frail seniors. And the services we provide are comprehensive intakes, assessments, care planning, referrals, meals, and wellness programs. We have case managers that assist these seniors. We get phone calls from landlords, from families out of state to assist these seniors, and along with all of that comes transportation concerns that they have, caregiver needs that they have, health questions that they have. All of those concerns are addressed by our case managers.
You say you're seeing an increased need
We have
for
seen an
your
increase
services?
because the aging population continues to grow nationwide and in the city in particular. We have a 15% population of seniors in this community. 21% are concentrated in that census tract area where the adult recreation center is. That is our main hub, and we've noticed an increase there as well. So with that comes needs in the community that we need to address.
Yes, thank you,
Commissioner Tusher.
Mr. Chair. I remember last year where my humble opinion was that this is for me personally, because my parents are both seniors and both, I think, high-risk, frail seniors, I think this is a really important program. And I wholeheartedly, support it. If I could give you the full funding, I certainly would.
I agree with Mr. Tashian. I think this is a great program. We had the opportunity to visit and see how engaged and your participants are. One thing that was brought to my attention a few months ago by a member who's also a relative of mine mentioned that they would like to see CPR classes. I think you had an incident at the facility where someone, I think, had a heart attack. I'm not sure what the situation was, but they were all willing to, kind of help. And that's what brought this recommendation that we would really look forward to see a CPR class. And I know that you can collaborate with the hospitals to have their emergency department or nurses or physicians come and just, offer this class at no cost. And I think that would be something, if seniors are asking and they want to learn, this is an opportunity to educate, and they can use it, just at various situations.
Very nice.
Yeah. So, but you're doing a wonderful job. Thank you.
Other questions?
Just a commendation. Weaknesses, none. Sounds pretty outstanding. And it is a very, very good program. I was with a senior friend of mine whose husband died, and called me early in the morning, and I went down there. And because he died at home, then you had to call the coroner and all kinds of different stuff. And a police officer showed up, and he stayed there until the coroner got there, which was quite some time. And he was so helpful, and I think he was kind of associated with the work that we do from this program. It's an outstanding program, and I have to commend the city that they can do it with $16,000.
Thank you for mentioning that, because I'd like to piggyback on what you just said. Our case managers every year schedule a police roll call event. They go out 6 a.m., 10 a.m., 12 p.m., and on. And we meet with all the police officers, incoming and current, and we try to refresh their memories of what we do, how we provide this program. And we get a lot of referrals from police, a lot of referrals from fire, just because we do these roll calls within our department. Actually, within our city, I should say.
But just to clarify, you do get other funding from the city for your program?
We get some
Not
funding,
just
yes.
this amount, yeah. Mm-hmm. Yeah. Thank you very much.
Thank you.
Thank you.
We're now officially ahead of schedule. How does that happen?
Less questions.
Great, good
Would you
teamwork.
like to take a break?
Great leadership, absolutely.
Okay.
We were just getting warmed up, I think,
I know.
at the beginning.
So now we have to wait.
Yeah, I think we should.
Now we gotta wait.
Take a
Like
break.
to take a break, Mr. Chair?
We can take a break,
10-minute
yeah.
break.
So happy, we may slow you down in the next little.
That's right. So let's take a break
Coffee's kicking in,
for
right?
15 minutes,
Sure.
I assume, or whenever they show up. How's that?
That's fine.
Thank you.
They'll get scared.
Ready? Okay, I'd like to reconvene Community Development Block Grant Commission meeting so that we can continue with our interviews with applicants for grant funding. So next I'd like to invite up Youth Employment Program, Glendale Youth Alliance.
Good morning. I'm Karina Gregorian with the Glendale Youth Alliance. For 22 years, Glendale Youth Alliance has been providing comprehensive programs to the youth of our community. We provide intense case management training as well as paid employment opportunities to low-income, disadvantaged youth in our community. Currently, we operate 5 programs. We serve 400 to 500 youth on an annual basis. We work with many of the nonprofit organizations within our community to meet the human needs of the youth in our program, as well as the business community. We work with over 100 businesses within Glendale, Burbank area that hire the youth for various positions. We have successfully executed 19 CDBG contracts, and in most cases we have met or exceeded the set outcomes and goals for the program. We're the only organization that hires 14, 15-year-olds within this community and beyond, I would say. And data proves that giving youth an opportunity at earlier stages in life significantly increases their earning potentials in the future. By giving our youth an opportunity now, we're getting them off the streets, we're reducing crime rates, we're putting them in a positive environment, ultimately breaking the cycles of poverty and giving them the skills to succeed in the workforce. We have many success stories. We have a full-time salary GYA youth participant or former participant currently in almost every department within the city of Glendale. Just this past week, 2 of our youth participants were hired by the City of Glendale Public Works in full-time salary positions. Last week we had one of our youth participants that started 2 summers ago. It was her first job in our program. And she got hired by a local CPA firm this week at the age of 19. So she definitely has a bright future ahead. And we also have youth that come to us that are on the verge of being homeless. They don't have parents in their lives. They don't have adult support. And we work very closely with them to provide supportive services, any additional resources that we can offer. We give them employment opportunities and set them on the right path for a brighter future. We do understand that the funds for CDBG are limited, and we do our best to stretch every dollar every year. We have 6 full-time employees, 2 part-time employees operating 5 programs serving 500 youth, and this is intense case management. It's not just referrals. And giving them jobs and processing payroll, doing fundraising events. There's a lot that goes on behind the scenes in the operations. So anything that we're given, I can assure you the money will be well spent, and we'll try to serve as many youth as possible. If you have any questions, I'd be happy to answer it.
A couple of questions.
Yes.
What's your intake process? How do youth get to your program?
Depending on the different programs, it varies. The grants have strict guidelines. So we do invite the youth and the parents to fill out all the necessary forms, to bring in income documents, right to work documents, and we check eligibility. If they do qualify for the program, we call them in for training.
I guess, how do they find out about you?
Oh, well, we work very closely with the school districts, with the nonprofit organizations, with the police department, and a lot of the kids are familiar with our programs. We have a question on our application, and 60% do indicate that they heard of our program through word of mouth.
And then on the other side of the process,
Yes.
do you track eventually where these kids go in the long term? Like, do you have any sort of statistics that show, like, 15% of them are doctors, or whatever it might be, that
we
wherever
try
they
to
end up?
We try to keep in contact with them as long as possible, but because they're so young and a lot of them go away for college and move out of the community, it's really difficult to keep in contact with them. We do follow up for a year after they leave the program, but after that, it just depends. A lot of the youth that do stay in the community do get involved, do come back to GYA fundraising events and keep in contact. But I can't tell you 10, 15 years from now. What I can share is that when I was 14, 15, I started in the GYA program. And some of my closest friends now are individuals I met when I was a youth worker. And one of them is an attorney, one of them is a businesswoman. Everyone's doing well.
Do you have statistics in terms of how many of them end up in college or in some sort of longer-term full-time employment in the closer term?
For certain grants, we do. Okay. 85 to 90% of the youth either continue education or go into employment.
Other questions?
We are actually accepting applications March 2nd for our summer program, but I don't think you would qualify.
That's a great program.
Thank you.
Other questions?
No, just one quick question. I'm familiar with the program, but I just want the audience to know, what is your summer program? Can you just describe it briefly, please?
Sure. The summer program actually has two components. We serve youth ages 14 to 21. They have to be from low-income families. The younger youth, ages 14 to 16, are placed in the brush clearance program. They work in teams for a period of 6 weeks, clearing overgrown weeds and brush on our public hillsides to prevent fires. The older youth are placed in different businesses, nonprofit organizations to gain experience, and they're paid for their work, $9 an hour.
So both programs, both
programs,
right? And they're paid for their work.
Yes.
Okay. Great.
Yes, and they receive training in case management and any other supportive services that are available.
I think it's very important, especially at that age group. Thank you.
Other questions?
We met yesterday and had lunch together. Never knew we would see each other
Glendale
today.
Latino Association lunch.
Till the end. I just was wondering. You said you served at youth risk. Is that the summer program? The 14 to 24, up to 24?
Up to 24. So depending on the grants or the enterprise programs, the youth can be older.
I don't think you could call 24 youth, can you?
Well, they're young adults, older youth, however you want to classify them.
It seems to me like...
I thought 50 was youth.
Yeah. It's all relative, you know.
Yes.
But if it's a youth program, I would think that you would have to cut it off in terms of our priority.
Right. As far as CDBG, it does go to 21 for the numbers that we report. Okay. But we do have other programs that allow youth to work up to the age of 24.
Okay.
Yes.
Well, maybe you should get rid of that 24 because it kind of is disturbing to me, even though I think there's so many 24-year-olds that really are needing assistance with jobs. But it is a good program. Good job.
And you say you pay the youth, you pay a minimum wage?
Yes.
Okay. So if the city were to consider increases in minimum wage, then that would impact your program?
Yes.
I only ask that because I know neighboring cities have considered or have passed such proposals that have been coming down from the national level. So something to consider for city council if they...
It's only fair.
Okay. Thank you very much.
Thank you.
Thank you.
Thank you.
Next, homeless outreach case management, Essentia.
Good morning, Chairman Armenian, committee members. I'm Natalie Komuro. I'm the Executive Director of Essentia. The proposal that we have before you is to request $30,000 for the street outreach program. This has been a longstanding program for the city of Glendale. Historically, we had 3 outreach team members who would go out to the community, talk to people who are homeless in the alleyways and in doorways and so forth and in the parks. With funding cuts, we had to cut back to 2 positions. We've had 2 staff members consistently for the last 4 years, and then added a 3rd during the winter shelter months. This last year, we've only kept the 2, Alfred and David. I think some of you may know them. In fact, Alfred had been honored by one of your committees, and David is a newer addition to the team, but he's very good at helping move our folks who've been on the streets for a very long time into substance abuse treatment programs and other kinds of medical appointments and those sorts of things. This past year, again, with thanks to funding cuts, we've been pulling together the funding, but we were forced to accept, well, not forced to, happily accepted a grant from Burbank. So in the winter months, we are only half-time here in the city of Glendale, and then we're half-time in Burbank through March 15th. But at any rate, our program has been consistently meeting its goal of reaching out to people who are on the streets. They're typically chronically homeless. They typically have high incidence of disability and chronic illness, addiction, and mental illness. And we have been enrolling them in the Access Center. They are an integral part of the new coordinated entry system that the City of Glendale and the greater continuum of care in Los Angeles County has been asked to implement as well. They also support, which is really important, is our hospital program, in which we're identifying frequent hospital users. They're our highest cost users of systems in the City of Glendale, and helping them move out of homelessness into permanent housing. They provide the transitional case management through that moving process to help acclimate the client in permanent housing and to transition them in a very seamless way to the ongoing case management that we provide to those people in permanent housing. They are very instrumental in our efforts to end chronic homelessness, and without them, we would not be having the success that we do have in helping the city meet that goal.
Questions?
I'm, again, very familiar with your program. It's great. Your new location is pretty cool.
I'm glad you like it.
Very nice.
Like it too.
But I have a question. So if Burbank invited you to participate in providing the service, and obviously has a time constraint.
Yes.
How do we know that you're putting all your efforts into our Glendale homeless population?
Well, when we're here, and we document when we're here, and when we're there, because they want to know that we're there too. So, so we document the people that we're working with. That'll show up in HMIS. We, clock in and clock out, and then they're supervised. I forgot to introduce Dr. Laura Duncan is our new director of programs. She oversees the outreach team as well. So, And Dylan. And let me just also add that we are leveraging a staff position from LA Family Housing. And Dylan is what they call housing navigator. And so he accompanies the outreach team. He also assists in the completion of the coordinated entry system assessment tool, which is called the VI SPDAT.
So the Burbank clients that you serve, they come to the Glendale facility?
Rarely. They often don't want to leave Burbank. That's a separate issue. We're trying to work with them. I'm trying to figure out a different strategy because even with the winter shelter program, Burbank residents or people who are homeless in Burbank really don't want to leave Burbank.
I imagine we're probably the same for the homeless.
And it's true in Glendale. The people who are homeless in Glendale don't want to leave Glendale. Yeah.
Okay.
Chair, I have
Thank you.
a question. So you're in Glendale now on part-time basis?
Just for the winter months. Just for the winter months, we are full-time the rest of the year. And if I'm able to get more funding, I'll happily go back to Burbank and say we need to hire a full-time person for you.
But the demand is still the same? It's just
yes.
Your hours hasn't decreased due to...
Well, let me explain something. When Dr. Duncan started in September, we were already ahead of goal. We were close to meeting the annual goal for the street outreach team in Glendale only. So she said, let's pull back, let's really focus on the people that we have, make sure that we're getting them moved along. And so our numbers sort of diminished in the second quarter on that front. And then with the responsibility in Burbank, we, by December 1st, tapered off some of our time here. Well, we tapered off half-time here. And then it'll resume full-time when the winter program ends in Burbank. So did I answer that question? Or
Yeah, pretty much, but I just want to make sure that we are meeting the needs of our own community.
Well, we are to the
our
extent.
own fundraising and really supporting the number of individuals that need our services, and having our program really flourish and be solid in Glendale before we expand to.
Well, I'll tell you something. If there's more money to do it,
Right.
we will happily do it. The problem is it's not just your CDBG funding has been cut. The SHP funding, which was the leverage for this program, has been cut. Our access centers lost over $130,000 in the last year due to sequestration and changing budget priorities. So with those shifts in funding, they've been very critical structural changes. We're making up a lot of it in foundation grant applications. I've been successful in doing that. We're also closing out a capital campaign. So when that ends, we'll again be recommitted to the operating programs. But the reality is this city, like every other city, has been facing enormous structural changes in the way you funded human services. The redevelopment money was another program that we've lost. It didn't affect this so much. It affected our shelter, but that's a gap I have to fill.
Sure.
So I'm pulled in a lot of different directions to fill these gaps, and but to the extent that we're here, we have a very effective team. We leverage that access center, which is fantastic. We have on-site psychiatric services and on-site mental health services, which are really helpful. We have the shower in the new facility, so the daytime users can use that and get cleaned up, and laundry there. So we're able to do quite a bit, but I think it's just the reality of where we are these days. So,
And then you also mentioned that you're working with local hospitals to coordinate the discharge planning. I know that has been an issue in all hospitals throughout Los Angeles and Glendale especially. How are we working through those issues?
We have a dedicated staff position. It's called a hospital liaison. They are out in primarily in Glendale Adventist Medical Center and Glendale Memorial Hospital. We obtain referrals of the homeless, frequent hospital users, even the not so frequent users. But the target for one of our projects is specifically the top 10% highest cost frequent users to the system, and then we move them into permanent housing and provide the wraparound services to them in their home. So the role of the street outreach team is to sort of provide that filler service. So for example, if the person is still in the hospital, they might go to establish the relationship. So once they're discharged, and depending, and this is problematic because sometimes when these folks get discharged, they ought to go back to the street.
Or they can't be discharged because we don't have a
One is they
place
can't
to-
be discharged. Some
can't place them anywhere.
Right, and then some might discharge themselves against orders, and so we want to keep track of them. The discharge placement is problematic. Our shelter can't take people if they're going to be actively using drugs or alcohol. So to the extent you might have a patient with those priorities, we wouldn't be able to put them in our shelter. We'd have to find some other place for them. But we have been working in support of the discharge planners. We've had a lot of meetings with those staff to make sure we can do all we can to help those patients.
Mr.
Every
Chair?
bit counts. Thank you.
Yes, Commissioner Tasha.
Yes, thank you very much. I have a multi-part question. My first question is how many homeless individuals are in Glendale? My second question is how many of those individuals are actually contacted by your case manager? And my third question is how many of those actually use your services?
Okay, so those are not the easiest questions to answer, but I'll try. First of all, the city of Glendale, that's a 2013 number. The correct 107? Point in time. Okay, so first thing to know about homeless count numbers is they are point in time. That means on any given night, 107 people would be homeless in the city of Glendale. Through the course of the year, that number gets bigger. Okay, but because we're talking typically about chronically homeless people, there's not as much churning, if you will, so the number might be relatively stable. I don't know if you have an annual number. Is it 250 or would it be around 300?
Yes. Chair, Armenian members of the committee, I mentioned earlier, 2013 homeless count, again, is 320 unduplicated homeless in the city of Glendale. Of those, 107 are unsheltered homeless that Ascensia's outreach team works with them on an ongoing basis.
So I don't know if that answers my question,
Right.
though. Maybe let me see if I could rephrase it, though. Let's just assume that there's 107, like you mentioned. Are those individuals actually contacted by case managers from Essentia?
So,
and of those, how many actually actually come into your facility?
right. Okay, so of the total number, and this is where it's very imprecise because, as an example, when we did the 100,000 homes outreach, the first person who was the most vulnerable, the person identified as most vulnerable on our list, we never saw them again. Okay, so even of the 107, we may see 107 people. Some of those people we may never see again. I don't know who all of those 107 people are because we don't name them. So, but what I would say is that as far as I know, anyone who has been seen on the streets of Glendale has been made known to us, and we've attempted to contact. It's just that's the way the system has been working. What has been interesting, what we found, is sometimes there's people who go to the hospitals that we don't know about because they've had a way of, they're cycling in and out so much and so quickly we don't find them there. Now, of the people that we contact, our goal is, I believe it's 65%, would get enrolled in our services at the Access Center. And this can take a lot of time. These are folks who are very resistant to, or distrustful, if you will, of services. They don't believe that somebody's actually going to help them. They may have an acute mental illness, and so that interferes with their ability to follow through. So there's a lot of reasons why we'll do the outreach, but it's not instant. It's not always that they're, oh, yes, I'll accept your help immediately. So that's the whole point of the outreach, is we have to keep going back over and over. So, for example, today one of our clients died. Or last night he died. This was someone who we had been doing extended outreach to over a year. He'd actually stayed in our shelter. He left because he couldn't handle the kids were a lot more than he could take. He felt claustrophobic, so he went back to live in his van, and regrettably, last night he died. But his trajectory, or his journey, if you will, is not that uncommon, is that with this population, we have to go around multiple times to reach them and try to help them. It's not a linear A to Z end.
Well, how do you reach out to these individuals? Like, I could go down Colorado Boulevard, I could go down Broadway. I mean, if you look sometimes at the U.S. Post Office on 313 Broadway, you'll see homeless people inside after hours, obviously, or on Colorado where there's a church and multiple areas. Well, how do you reach out to these people? I'm sure law enforcement has some sort of input, and perhaps there's other individuals or agencies that have, but how do you get out to these people? I mean, and at what hours and what time?
Well, we have our set hours, so the team comes in at 7 in the morning, and then they get out to different locations. So it's two different ways. One is somebody will call us up and say, hey, I know there's this person on the park. Could you go see who this person is in a park? And so we'll go out to the park, and ideally they'll still be there. We'll try to get descriptions of people so we know who we're looking for in case they're not in that precise vicinity. We frequently get calls from the city of Glendale, from the staff who tell us they're hearing or they're seeing people out in the community. And of course, we work really closely with the Glendale Police Department to find people. We also have ongoing relationships with some of those folks. So they're going back out to a pre-designated place to say, okay, we're going to meet, and then we've got an appointment, and we're going to go take care of that business together. And so they may be, you may be seeing our outreach team at the Social Security office because they're helping someone get that appointment done, or to the Department of Motor Vehicles because we must get the identification before we can move forward with a housing application. So every day is going to be very different. Sometimes we're down by the river. If we're trying to find somebody and we think we've been down by the riverbanks, we'll go there. It really can vary because this is not a predictable population, if you will.
I think it's extremely difficult. I just think that when I see this, and I see a lot of them cited for trespass or illegal camping, and it's repeatedly done.
Right.
It's like a cycle. They can't break away from it, and eventually it leads to confinement, jail time, etc. So it's very difficult.
Well, the challenge, particularly this year, and I don't know what it'll be like moving forward, is there's no winter shelter. There's no low demand, if you will, no year-round low demand shelter, meaning a shelter that doesn't have a lot of rules for people in this population. So we do what we can to be flexible in the emergency housing program that we do have at Ascensia, but because we serve families with children, we do have to have some parameters. The move of the winter shelter to Pacoima meant that some folks are going, but not everybody. And so we don't have that resource, and we don't have the day center that would be really nice to have too. If we had a day center where people could really feel comfortable to hang out, if you will, that would work. We're exploring how we can use our access center to that effect, but we haven't come on a solution that would be exactly that.
Thank you.
Can you just speak more to the winter shelter? Because there's a perception that Ascensia had the contract to run it, and
we did have the contract to run it.
Then something happened.
Something did happen. The contract is contingent on having site control. And so the first year, it was a 3-year contract. The first year we did use the Glendale Armory. And the second year, we had vacated our property that we were leasing on Fernando Court, and we used that. And this year, neither of those were available options for us. We spent the better part of 5 months. The staff here helped. Dr. Duncan, when she came on board, also. We tried to find some place where we could lease for a 3-month period or 3.5-month period a property suitable for the winter shelter program. It simply wasn't possible. I reached out to Los Angeles. I asked the City of Los Angeles council member in Glendale Park for help, and we had a few leads, but nothing materialized, obviously. And so we were faced with. We did offer a proposal, but it was a partial. We could serve a part of the population in the access center, but LASA didn't accept that, and so they went with the church in Pacoima.
And what happened with the armory, use of the armory?
Well, my understanding is that the City of Glendale didn't want us to use the armory.
Oh. Okay.
But I will defer back to the City of Glendale for that.
Yeah, that's interesting.
Other
Was that a zoning issue?
I can't speak to that.
We've done it in the past, over and over.
Let me just, in fairness, let me just say this.
Please.
The winter shelter program is very thinly funded. It does not allow for payment of services beyond the 6 o'clock in the morning. Okay? Well, but the 6 o'clock in the morning is actually not a funding thing. It's that the Armory had us out at 6 in the morning. But then there's no funding subsequent for services. So what happens is people leave the Armory at 6 in the morning. What are they going to do? They go across and hang out in the park. They create disturbances at the recreation center and the library in the downtown area. So we don't have the capacity to help all of those people. If it's an 80-bed shelter, imagine, if you will, 80 people, most of whom don't have jobs, and many are mentally ill, they don't have a place to go to. So without a daytime option.
So that's what the daycare center idea.
A day center would be, I think, really helpful. Right.
And it didn't make any difference in the past, but recently it does. Probably.
Well, the adult recreation center had been under construction in prior years. Now it is nice and clean, and frankly, there was damage.
We don't want homeless there.
Well, I don't think it was a matter of. It was what some people were doing, and some people were.
That's why we need
messing
the
up the property, if you will. Excuse me?
That's why we need the outreach.
Well, that's why we need the outreach. Well, that's why we need more affordable housing. Just get them off the streets. So it's not a simple fix. Obviously, it's not a simple fix.
It's tough.
I have one question, which is, so you got $24,500 last year.
Mm-hmm.
According to the report, nothing's been expended or no invoices have been submitted. Mr. Carrillo, is there any update to this?
Correct.
We have one invoice that's imminent. We're just waiting for our CFO to sign off on it. The reason for that is that this program was also receiving foundation funding that we needed to spend out first. So it's a matter of timing. But before the end of the fiscal year, we will definitely be spending this grant out. So it's the cycle of funding for the program.
And your audit is coming?
Excuse me?
Your audit?
Yes. The audit committee did review it, and there are just a few minor editing changes that we're waiting for, and our board will be receiving it March 10th, and then I'll be happy to forward it to you. We're still a low-risk auditee according to that. So.
Questions? Okay. Thank you very much.
Thank you very much.
Next, I'd like to invite STAR program, Students Training as Role Models, Glendale Police Department.
All right, good morning, everyone.
Good morning. My name is Norma Maurer, Community Services Community Services Coordinator at Pacific Park, where we house the STAR program.
I'm Officer Alex Z with the Glendale Police Department. I assist with the STAR program.
Time. Did we move the podium over? I'm thinking that maybe the camera might be able.
Well, they look good on camera.
They'll get it.
We can see them.
They're in uniform.
Well, we usually have it in the middle, so make sure it's a good angle.
STAR Students, which acronym for Students Trained as Role Models, is an
I'm sorry, you're going to have to.
Is an existing after-school program operated by the Glendale Police Department. As of January 1st, 2012, Officer Jackson and myself have carried out the main leadership roles in the program. Officer Vahe Brahman has also assisted well in the absence of Officer Jackson. We've assisted with planning, lesson development, and monthly outings with the STAR program. Throughout the year, various officers within the Glendale Police Department frequently assist and participate in our activities. Due to the participation of these officers, we have been able to better serve our students. Since 1995, STARS consisted of intensive mentoring to young people ages 9 to 14 by uniformed police officers and program staff through a variety of activities, including tutoring, training in life skills, and positive personal development, community service experiences, and recreational activities. The purpose of the program is to give at-risk young people in Glendale an opportunity for a better future through academic achievement, excellent life skills, building a personal relationship with law enforcement, and understanding the importance of community service. Our service location is ideally situated in the Pacific Park Community Center. We meet every Tuesday between 3 and 6:30 p.m. and take students on one day-long outing each month on a Saturday. Each Tuesday, students walk to the center and check in. The first hour is spent completing homework. Recently, we were able to obtain extra school book copies so our students are able to complete their homework at the program. We tutor students and encourage older members to help the younger students. We have a library that kids select from for quiet reading if they finish ahead of the group. We usually have game or outdoor time before we sit and share our dinner. Our games are structured around team building. Adding a competitive twist allows the students to have fun while learning how to work closely with each other. A wholesome meal is shared, and then we have announcements before we begin our structured lesson. Often we utilize the vast resources of the Pacific Branch Library, the gym, or athletic fields for play. Once the meal is prepared, the officers in charge will help serve and share dinner, and then be present for the remainder of the evening. Lessons are taught for the last hour of the night. Our population is identified as low to moderate income based on a 2010 census tract information, along with information gathered by the feeder school and collected income. Verification required by CDBG. Every student currently served resides in a tract with 56% or more identified as low to moderate income. We serve low numbers each year because we don't have a drop-in component in our program. Kids that start at 9 are not graduated from STAR until they reach high school. The ones that leave do so due to extreme behavior, family issues, or because they move. Traditionally, we serve between 15 to 20 kids each year. Numbers are deceived because we serve and support the entire family as well. Older siblings still get mentoring, parents are assisted with employment and housing, and entire families benefit via holiday donations and collaborations with other city agencies. One of the most beneficial rewards that students receive from this program is the constant monitoring of their academic progress. Officer Jackson works as school resource officer, and and it has become evident to her that most students who do poorly in their academics and or have behavior issues lack the parental support and guidance that some children need to be successful. Since Officer Jackson started running the program, her focuses have been dedicated to providing as much academic support, mentoring, monitoring, and encouragement as we're able to. Each student she contacts, each semester, Officer Jackson contacts each student's teachers to inquire on their grades, attendance, and behavior. For this reason, and because of our limited budget and staffing, it is ideal that we limit the number of members to better serve each student's individual needs.
Excuse me. So at this point, we're requesting a funding request of $20,200 to cover the cost of an employee to assist with the clerical, as well as some funding for maintenance and operation budget as well.
Right.
Questions?
I have a question. What are the hours for your program? Is it a daily program that?
We meet every
It's on
Tuesday
page 5.
from 3 p.m. to 6:30 p.m. and one outing, usually on a weekend,
Right.
like a Saturday. That outing consists from anywhere from 4 to 8 hours, depending on the outing. And outings are both service and fun outings.
And if you don't receive the grant for the full funding that you're requesting, how do you subsidize that? I mean, I know that even last year there was a variance between.
Well, our program coordinator, which is usually a parks employee, helps us with a lot of administrative duties, record keeping, a lot of the administrative work that's behind the STAR program. Officer Jackson supplements that between her shift or her job as a school resource officer and her administrative duties at the Cops Bureau.
So no additional fundraising? Just
The additional funding that we lack, the Police Foundation has additional money set aside, but it's primarily due to fundraising that is done by one of our volunteers, Dorothy. She has been with the city as a volunteer for over 20 years with the program, and she goes to like the Board of Realtors every year and requests a donation to the program. So that helps support some of the funding needs that we have for field trips and for meals and school supplies and things of that nature.
That's great.
So if I can follow up on that, so you work for
I work for
Parks and Rec, and your time then is basically being donated by the city?
A percentage of it is considered as part of the budget, but we do not request it from CDBG.
CDBG, correct. And the policeman's time is paid for by the police department?
By the police department.
So that's in-kind donation, if you will. So the monies that you're requesting are really going to support the kids' programs?
It's directly. It's to the hourly wages cover a Recreation Leader 3, which is approximately at about $12.57 an hour, and that's primarily to handle with hands-on behavioral management with the kids, play, academic support, as well as a person available on site when the program isn't going on, so the kids have access to someone available throughout the week for office hours. And they handle all of the quarterly reports. They retrieve all of the progress reports. They handle all the calculations that we need in order to give back the data necessary for the funding.
Okay. And then I was personally involved with STAR on an outing, I'm going to say 10 years ago, where we took, I'm going to say 10 or 12 kids to the Peterson Automotive Museum, which was a great event, and some professionals spoke to them and so on. What kind of outings are you doing now?
They vary based off of our budget. So if we were given a generous donation from the realtors, we try to stretch that out throughout the year. Sometimes we do free visits to the museum when they have the free museum days once a month. We also go to the zoo. We've done trips to the beach. We've gone hiking locally for low cost, and we also try to fit in one or two big outings where it's like the major incentive to get the kids to stay on board and excite them towards being in the program. We've taken them to Knott's, usually during the police officer discount time, so we're able to get a bulk rate at a good price.
Thank you.
Other questions?
Well, as I've said before, this is a program that I really like. I think it's a unique opportunity for our young people, especially our kids that are at risk, to work with police officers and have that opportunity on one-on-one like big brothers and sisters. And so I really think that it's a very good program, and it's a very effective program, because that's one thing that we need to, I think, build in our young people, this confidence and trust in law enforcement. And I think when you get that on early on, it does flavor how they act, how they respond, and how they communicate to others. So I think it's a very good program. I think it's unique to Glendale. And I like to see it continue, but gosh, the funding it's actually not that bad when you consider that the department and your other efforts and your volunteer times funds so much of it. So I like the program.
Thank you.
I have two questions. One, Mr. Correa, under weaknesses, it said actual outcomes for current program year required by the proposal were not provided. Has that been provided since this was printed, or no?
Well, Mr. Chair, I think that's just what they just handed out. Their outcomes weren't reported in the application. So if you look at page 9, their outcomes are based on the improvement of grade point averages. So the younger elementary school kids are tested and are shown report cards, and then the middle school kids are also outcomes is based on their grade point averages, and both show improvements. And so the majority of 95% of them have shown improvements.
I guess my broader question is, we obviously get requests from a variety of types of what I would call mentoring / after school, at-risk youth type of proposals. And I know that the police department, especially with school resource officers, has a unique perspective on some of the problems, but at the same time, your core business is law enforcement, not tutoring and after-school programs. So I'd like to understand a little bit better why the police department wants to be in this business, what it sees as a differentiation between other types of programs, such as that the Salvation Army and other organizations provide.
Well, yeah, it is a police-run program, and what I wanted to say earlier was, one thing I like about the program, we don't push the students to be police officers. We're a mentoring program. We encourage them to seek in their futures what they want to do, lawyers, doctors, businessmen, whatnot. What's good about these kids being mentored by us as by police officers is that it shows that we're approachable. Oftentimes the parents, and this from coming experience, would come up to us randomly on the street while we're working, asking us to discipline our kid for them, and it makes us look like the big bad guy. And what I tell the parents is, what I think it negatively reinforces the kids to believe that, to fear us. And as police officers, we shouldn't be feared, unless you're a criminal and you commit the crime, then yeah, we're going to come arrest you. But that we're approachable, and with this program, it shows these students that they can talk to us face-to-face, one-on-one. And that's why we also bring in other officers, either motorcycle officers for pedestrian safety, traffic safety, have narcotics officers, canine officers. So it introduces a lot of officers to the students, and it shows that we are approachable. You can come to us for advice, and that we shouldn't be scary to you.
And what's your intake process? Like, how do you select? Obviously, there's probably more need on these sorts of programs than there is ability to serve, particularly in your program. So how do you go about selecting who you bring into the program?
We usually try to take the siblings first. Currently we have siblings within the STAR program, and as they grow older, if they're other younger siblings in a family, if they're interested in a program, we'll review the application before the rest of the waiting list. But we try to take siblings first, because we don't just help out that one STAR student, we help out their families as well.
But how do people know to apply to?
I can go over the process for that. Since Pacific Park is located right next to Edison Elementary School, that's our feeder school that we really look for, the 9-year-olds. But we have been approached by parents of 11-year-olds, kids that are going to Roosevelt as well. That's our next school, just because we're walking distance. So the The first thing is we have a really good relationship with Edison Elementary School administration and principal. So we communicate with them about the program, and if they have any recommendations, we work with them first. And then from there, we have interest forms at the community center. So if anyone's ever interested just in even being put on the waiting list, they can fill out a form, submit it. It stays on file when we start looking at applications or spots that open up, because every year we graduate kids that are going into high school. So spots open up. We start to look at the applicants that are interested, and then we make calls to them, and we set up interviews. And this is what the officers are involved in at this point. They sit down with the families and have a full interview with the entire family, because they want to stress the importance of the commitment from the family to the program, not just the child, because we want the child to be successful, but they need to have the support of the family and understand what our expectations are at the program. Once they've been interviewed and approved by the officers, then they fill out a full packet, which is the CDBG form, that the AIF, or the applicant information form, that indicates their income, how many people live in the household, and then we take care of the paperwork process, and then we start scheduling them to start the program on a probationary period. The kids are able to attend for about a month. If they're consistent on arriving on time, communicating with us if they have other conflicts, then we make them officially part of the program, and they're issued their T-shirts, which makes them an official member of the program.
Is there any sort of collaboration with the medical community? Because sometimes, obviously, behavioral issues deeper than require more professional.
Yes, Officer Jackson has quite a few referrals available to her for mental health as well as medical issues. We have had some kids that had like appendicitis and they didn't know what to do. They were very young in the program. Parents didn't know what resources they had available, so we gave them medical. We've had kids that have had families with drug issues that we've been able to give them resources, but Officer Jackson and the police department has a full list of resources available.
And I also think what makes this program different and differentiates the program with others is that the collaboration with the law enforcement, and from a younger age they can see that this can be a very friendly and collaborative environment versus what the perception of some families and kids are when it comes to police and law enforcement. So this makes it completely a new perspective for them.
If I could speak on that, I've worked for multiple cities throughout California and the state of Washington, and I've been here for 12 years, and it is very unique. Mm-hmm. I've worked in after-school programming for the past 20 years, and in all of those different cities that I work for, Glendale has been the only city that has a collaboration with parks and the police department to be able to offer such a structured program for so long as well.
Commissioner Tushin.
Thank you very much. I know you target at-risk low-income students between ages 9 and 14, but do you prioritize those students based on, let's say, a juvenile history, or perhaps they're taggers, or perhaps they're about to jump to Tunerville or some other gang in the Glendale area?
Mm-hmm. During the interview process, when we're working with a family, usually when we get referrals from Edison Elementary or from Roosevelt, from the administration, it's because they've had behavioral problems, or there are at-home issues that could potentially lead for them to have behavioral problems. So we'd like to catch them early and give them a strong support system to them and the family. So we go through that. Doesn't mean everyone who doesn't have a problem is rejected, because we do have some kids that have really strong families. They just live in the area. They're lower income, may not be at risk due to behavior or academic issues, but they're also considered for the program as well. But we do try to take the kids that we can help kind of grow them through middle school, especially those tough years.
Isn't it essentially a part of the community policing program?
Yes, it is.
Well, I have to commend the police department on the amount of time you give to it and your dedication, your commitment to this program. I think over the years, I think it's paid off.
Thank you.
On a separate note, is the boxing program history completely, or is that still being talked about?
Why do we have rules?
I don't know. I was never involved in the program. I'm not too familiar with that.
It's part of YMCA now.
Committee Member Olivares, that is run by the Glendale YMCA, and it's still operating twice a week. PD does make visits there, and it's still a semi-partnership there.
So you're still involved in that program, though? And I knew you went to the YMCA, but thought it was completely different now.
I think that's a different police unit, possibly.
Yes, it was.
I've
Yes, it is.
one more question. Have you considered, in terms of broadening how you reach your goal, which is obviously to intervene with at-risk youth, by partnering with some of these other organizations that are doing their own programs, such as the Salvation Army? I mean, if your objective is to create a friendly face of law enforcement and a relationship,
Gave it to us.
you know, you could do, rather than just doing it with such a small population of people that you're able to accommodate in your own program, there's obviously a larger population that's coming through the other programs.
We have partnered up with Salvation Army. Our main volunteer, Dorothy, she is an advocate for them. She also provides all of the training, or has been trained on the Safe Place. So she, on behalf of STAR, as well as educates our kids about Safe Place, which is a Salvation Army program. She is valuable as a STAR employee or STAR volunteer, but also as a Salvation Army volunteer. So we get a benefit both ways from her. We also work with Dee Dee Hirsch for mental health. Anytime they want to give us any education that is specific to that age group, they provide some activities on occasion for educating the kids in a fun way, lesson plans. We work with the school district, so we're trying to reach out, but because of our funding and because of the officers' limited schedule, we try to prioritize with just the 20 to 25 kids that we serve in the program, but would love to be able to expand if given the opportunity.
Thank you. Thank you very much.
Thank you.
Thank you.
Behind schedule.
My
We
fault,
went off
actually.
schedule. What happened?
I disappeared for about 15 minutes.
We'll just take
What
Okay,
happened?
so we'll take a lunch break at this point.
It's been sitting
We'll
there
be
for
back
half
here
an
at
hour.
1 o'clock. Microphone's on. Welcome back to the Community Development Block Grant Advisory Committee meeting that we started earlier this morning. Just to recap what we've done thus far, this morning we reviewed the available budgets this year from Housing and Urban Development, and we've heard from all the applicants for grants and had a variety of question and answer sessions. And at this point, we will now move into a discussion by the committee members about all the grant applications and then start looking at the finances, specifically about the social service funding recommendations. On Monday, we will have a separate session for capital projects and that funding. So I guess at first I will entertain a discussion, a general discussion about what we heard today. One thing that's clear is that there are more requests than there is available funding, so we will have to go into some specifics in this discussion at some point to talk about whether or not, what our approach is in order to make this balance out with available funding. Some approaches could be to reject some of the applicants, which would reduce the demand on the funds. Another approach, of course, is to spread out the funds in lesser quantities than what's being requested amongst the various applicants if we feel that they're all worthy, et cetera. So that's the kind of discussion I'd like to just start by just providing a little bit of opportunity for each of us to make some comments, and then we'll dive into the details. Who would like to go first?
Thank you, Mr. Chair. I really appreciate the overview, and we have 13 great proposals in front of us, and it makes it very difficult because every program and every service offers such unique program and services in our community that would be very difficult for us to eliminate, at least in my point of view. However, we have a deficit of $334,000, so we need to work with what we have available, and I'm confident that at the end we will deliberate with a fair and fair proposal, right, and recommendations. So we have some work ahead of us.
If I may add something to that. So we have 13 proposals, of which 11 are currently funded. The current funding is for $257,000. Sorry, yes, current funding is for $257,000, and we have $237,000 available. So, in a simplistic way, if we didn't fund any of the new proposals, we wanted to fund all the existing proposals, we would still have a deficit of $20,000.
Fund them at last year's level.
Last year's level.
Yeah.
We would still be at a deficit of $20,000. So
Correct.
that's how complicated this is.
Yep. Commissioner Tashian.
Sure. I guess the first question is, are there any programs that we do not want to fund, as you had mentioned, Mr. Chair? If there is programs that we do not want to fund, then perhaps it becomes easier for us to deal with the other programs and the allocation of funding to the other programs. I haven't definitively made up my mind with respect to which funding that I don't believe that we need to fund, provide monies to, and I'm still debating that at this time, quite honestly.
Commissioner Ramirez.
Well, maybe we can start out by funding fair housing, since we have to, so that's a must.
We'll get into,
And then
into some specifics. I kind of tend to go with what you hear and see which ones we're less inclined to fund. So from my perspective, there's a certain tipping point where you start spreading funds too thin. It becomes difficult for anyone to be successful, number one. It starts to put into question the viability and sustainability of the program, which I know is one of the considerations that staff looks at when they're looking at the finances of these things. And I know in the past we've had a situation in my short tenure on the committee where because of the low amount of the funds, one of the grantees actually gave back the money because they felt they couldn't be productive with it, and we ended up doing a special RFP for those remaining funds. So my philosophy in this situation is not to continue eroding funding across the board, but start to make some tougher decisions, and this is just my personal opinion, obviously, start making some tougher decisions about who not to fund in order to maintain funding levels on a level on which you can make a meaningful impact and difference in whatever areas or programs, because each of these areas, I think you could make an argument for pretty much any of the proposals that they meet a need in the community, a very important need. The question, though, comes into play if the organizations don't have the ability to make up significant shortfalls in their request, then whether or not they go forward with their programs. And I think Commissioner Olivares, you asked that question pretty consistently throughout the program. Some of them answered that they would. Some of them answered that they would actually cut back the programs as a result because they don't have that sort of surplus funding to fill in the gap.
I'd like to propose that we take a look at the two new programs and let's have a conversation about whether we want to consider them or not, or overall scheme of things, whether we think it's one of the more needed programs in the city. And with that, we have item number 2, which is access to health care for underinsured children by Glendale Healthy Kids. They're asking for $30,000. They have not been previously funded for that program. And we also have the number 4, which is the gift program expansion, asking for $50,000, again, which was not previously funded. So, and I'm going off the philosophy that if we did not fund those two, and I'm not suggesting that we don't at this point, that we would then be a little bit closer by $80,000 to.
I have a question for staff. As I recall, Glendale Healthy Kids did apply maybe 2 years ago. Last year, and no, but previously, have you ever funded them? I remember $25,000 funding that they gave back or they never used. I'm correct?
Last year, we encouraged them to come back this year, and we didn't fund them.
The proposal that they had submitted last year was essentially the same, and I think the last couple of years been pretty much the same. The UC Mobile Dental Clinic was probably the last time we did that project, and it was maybe 6-8 years ago. I can't remember the timeline.
And we funded it for a few years.
Yes, that was. Now that's different from the program, which is being requested now.
I like to see us funding. I mean, I understand that if there are new programs, we want to reevaluate, and we already have existing program with great track records that we want to continue funding. However, I don't want this to become, something that we do every year. All the new programs we start eliminating, and I want to encourage new programs and new services to come forward with their proposals, with their new offerings to the community, and. We went through the same process last year where we eliminated, and this year I'm only seeing one brand new program, and Glendale Healthy Kids has been in, putting in proposals in the past as well. So I'm not very, inclined to just eliminate every time we get a new program in place.
Yeah, and don't get me wrong, I'm not suggesting that at all. I'm suggesting we have a
just to evaluate
conversation about what it
agree.
is they're offering, and then do we want to keep it on the table or not, as it relates to everything else.
Sure.
Yeah, I mean, I think we need to look at everything on its merits. For those who are new, obviously we need to factor in, their ability to be successful, since in some cases we might not have a track record, although Glendale Healthy Kids is a known organization in our community. In other cases, they may have been doing the program for a while, but again, we ought to be evaluating the track record and the effectiveness of the existing program, again, from a merit perspective. and then the ability to be successful. I have no doubt that everyone on this list has good intentions. I don't think anyone's questioning the intentions by questioning whether or not we fund them. I think we just have a tough choice in front of us, and we have to evaluate each one.
And if you look at every single organization that's here, aside from perhaps GIFT, every single organization here has had funding from CDBG for a number of years for basically the same programs. That's what makes this so difficult.
Maybe that's what makes it easier.
Well, I mean, I'll give you an example. It might make it easier in terms of knowing about them. What makes it harder is when you have less money.
Well,
and
yeah.
And you hope to, at some point, like I said, at some point there's a tipping point on effectiveness when you cut it too small in order to make impact. I'll give you an example of what I personally mean by that. I would love to see CASPs go from 15 to 30,000 and see them go into a second school, right? I mean, that's an example of a lot of effort and volunteer time being put into that program. And, by going from 1 to 2 schools, you're really broadening the impact of the program. But then that adds 15,000 onto the numbers. And for you to have that 15, you have to cut back from somewhere else.
Right, but then again, looking at the success of the other programs and their ability that has been increased based on their track record and community support, they can probably, kind of increase their own fundraising efforts. I mean, I'm just trying to say that some of the levels can change.
Agreed.
Some of the levels of based on them really being out there and having their name out there and being able to really attract
and I think
new donors.
Building on your point, Commissioner Markarian, I think some organizations have more of an infrastructure with which to do their own fundraising, and we know that they do more fundraising, and you can see it in their budgets that they kind of have more out there. So I think that would be an important thing to factor in, not to penalize someone for being organized and having the ability to raise funds, but I think if there's another organization that doesn't have that infrastructure but could use, where the CDBG funds can kind of get them off the ground
Till they get to that level.
Yeah, we should factor that in as well, I think, in our discussion.
And also the needs.
Yep.
Highest and best use.
I mean, the other thing we could look at here is, different programs serve different parts of our strategic plan in terms of needs. If you were to prioritize it, would you put any sort of prioritization on, homeless programs versus at-risk youth programs?
I think this top 13 is pretty much prioritized. Right? Would you agree?
Yeah, but I mean, if you have to,
all
if
the
you have to
safety
force
net
rank
programs, safety net programs from youth to seniors to homelessness.
Yeah, but what I mean is, so if there's 4 programs that deal with at-risk youth, 3 programs that deal with, homeless issues.
Right, so kind of.
You can kind of say, all right, well, how many of each category am I going to fund at what level?
Well, I mean, I think, for example, CASPS has a unique program that Glendale Youth Alliance, which may serve the same age group or similar age group, does not have. I'm not that familiar with GIFT. I don't know too much about them, and I really didn't quite understand their presentation today as well as I would like to have understood it. I think Glendale Healthy Kids does have that infrastructure that a lot of some of the other organizations don't. I think the Armenian Relief Society does have that infrastructure, and Catholic Charities do. So I think there's a lot of factors that come into play that I think we need to make a determination on. And also, as you mentioned, need is important. And obviously, all of us probably have certain programs that are more endearing to us or more important to us. I certainly do, and I'm sure all of you have that also. So where do we start?
We're also looking at the duplications. That's what I think Mr. Armenian was mentioning.
Right.
Looking at the duplications.
If we look at just the table of numbers, and I'm looking, for example, at number 3, the after-school program at 11,000. Home and Edmond, who historically has received more money for the impact they have at 11,000. Fair housing program, which is a must, at 9,000. There's no program as efficient as that. Then we go to 15, 35, 52, 16, 50,000, 24, and then 12,000 for the STAR program. So I'm looking at 1, 2, 3, 4, 5 programs that are under 15,000, somewhere between 9 and 15,000. Could those programs afford to be reduced any? I don't believe so.
That's what I mean by the tipping
But can
point.
we go back and just put those numbers as to start as a
The low
minimum,
ones?
the low ones? That way we can at least have some kind of a direction.
So
Because
meaning
if you were
keeping them at the same.
At least at the
same-
moment, keeping them in there only because I don't think it would be efficient to
Go any lower.
Go any lower.
That's
and
the
then-
floor.
But you can't go
Either you
lower.
Don't go lower or don't give them anything and the program disappears. And we are
But,
ready for that.
well, take on the Home Minuteman program, he said that if, without this funding, they can't do the program. But the program
For the
doesn't,
sake of just starting to see it, Iris, if we can take, if you look at the 2014 numbers, all those that are, let's
Under
say,
15?
yeah, let's do 16 and under, because there's a 16
So
there too.
we're looking at number 3.
Just to be clear, currently on that column, we have the requested funding. Would you like me to keep the requested
No, on
funding?
the 14, 15, you have current funding, right?
Recommendation.
So under far right, what we want you to do is anything that's under 16, put the same amount as they had under 2014-15 funding. So,
And then when we
so
say
starting
number
with
three,
the zone,
11,000.
I would just put 11,000.
When you say under 15, meaning current funding.
Yes.
11,000.
Home and Men 11, fair housing at 9. Skip those. Oh yeah, that one 15, right?
CAS is at 15.
Did you say
and-
16 as well?
Yeah, let's do 16 as well.
Star 13.
Okay.
So now you're still 250,000, 253,000 over.
So about 100 adjustment right there.
86. But that 86 is
37.
asking for 86. Is that 86?
Which one?
That 86,000? Yeah.
So what that really says then, we got to look at now the bigger numbers and see which ones could
And
afford
start
to be
bringing them
reduced.
down.
And to what level can they be?
Well, let's do this.
First of
How about
all-
if we took on the high side, right? If we took ARS and Youth Alliance, which were in the 50s, they've asked for more, right? If we bring them back to their 2014 amounts, again, this is just in an effort to start getting closer to our goal.
I just feel like even their 2014 amount, because they had a cut this year, even their 2014 would be difficult to match.
No, I know, but I'm saying just so we
Right
get
now?
closer for now. We know we're not going to go to 86,000.
No,
right?
because the 2014 was a funding of 50-something, so I'm thinking
I
even
know.
bring them to a 48 level.
So look, even if you do that, okay, so we just did that, we brought
Okay.
them down, that got us to 203 for 2014 levels. We're probably going to have to go further here,
Yeah.
but
Mr. Chair, what if we just took the 5 that are under 16,000 and discussed whether or not we want to increase any of those programs?
yeah,
Is
like
that-
I
is-
propose CASPs that we go up, right? What I'm trying to do is get us a
Where are you
little bit
gonna get it?
closer before
Where are
we
you
go
gonna
back
get
up.
it?
But
Yeah.
before we go into the other programs, because I don't know if that's easy or not. I mean, I know that I'm interested in increasing caps. The Salvation Army, I mean, I could leave as is. Home Minutemen, out of that, I could leave as is. The Community Services Parks and Department, I could leave as is. The Housing Rights Center, I could leave as is. I don't mind. In fact, I would encourage increasing CASPs. But perhaps we can discuss that before we go into the other programs.
Yeah.
I mean, when we talked to their representative, she mentioned that minimum of 12,000 is needed for a program, and they're doing their own fundraising.
Right, that's why I was saying.
Talking about CAS.
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 I was saying, my desire would be 30, but at minimum I'd
I'll
go to
say
24.
24. I'll say 24, just to give them that bare minimal, and then they can do their fundraising because this would really give
12
give them a
would get you
position.
another school.
Right, I thought it was 14 change, and I think Mr. Carrillo's indicated.
Was it 14?
It's 14 change, that was at least for one school.
That's what they're funding.
That's what.
No.
So it would be 28 instead of 24.
I'll just interject real quick. Yeah, I believe it's $12,000 for just psychology, but then adding the other expenses, it's about $14,000 per
They
additional
also do
school.
some fundraisings themselves, right?
So let me suggest this. Let's go to 28. We're going to still play with this. None of this is in stone,
Sure.
right? I'm just trying to see where we get to with numbers. And then my other question is, so Glendale Healthy Kids wasn't here last year. They came in with 30. Are you going to give them? We're not giving anyone else what they're requesting.
I'll
We're
say
giving them
maybe we
percentage.
put in a 15,000 placeholder.
Okay. Again,
Again,
we're just playing with numbers
Right.
here.
I think with Glendale Healthy Kids, they're doing such a great job in the community.
No,
and
I
they have great
agree.
supporters.
Absolutely.
So this
And they do good fundraising, too.
right. But I still want to see us supporting.
Then same with the gift program. I mean, that's coming in at 50 and staying at 50 so far.
Let me say something about the gift program, all due respect to the presentation, but I felt the same way. I think they answered the questions and they were answered. But if you were to ask me exactly what the outcomes and benefits would be, I'm not quite sure. I think I understand the program. There's a reason why we didn't fund it last year, and I don't recall.
They came in for a completely different program. This is the mental health
So
aspect.
I know they have a commitment with the city, with the location. Important that is, should that be a factor in this decision? I'm not sure. But I think of all the programs in front of us, that would probably be the one that I personally would be least inclined to fund, at least this year.
Because they wouldn't feel the impact.
Well, I don't think it's really, it is within one of the priorities, but I don't think it is the biggest priority.
Well, and my other view on that one is when I see granted, it's high-level professionals that they're employing for the purposes of achieving the program, but at the same time, there's no other organization in here that has a $2 million payroll.
Mm-hmm.
Okay, so, and they do have multiple sources of income that they're looking at that the other organizations don't have that benefit. They're really relying on these dollars, whereas they have kind of more programmatic dollars, healthcare dollars that are flowing into their organization. So, I mean, I'd be inclined if I had to pick one not to fund at all, that would be the one that I would have to look at, only because of those factors. It's not a reflection of whether or not they're doing important work, because I think it's all important. It's just a matter of who has the ability to continue with their programs if we were not to give, and that would be one of the programs where I think they would be able to continue it.
I mean, just knowing the background of the organization with 7 locations, just serving community with their healthcare needs, and now they're adding a component for mental health. I mean, this is extremely important.
Absolutely.
And but if we were to really reduce that 50 to a 20 or a 15, I'm not sure if that would make any impact
Difference,
in
right.
their program. The amount of paperwork and everything that's involved for this and what that contributes to their program, that minimal amount, I'm not even sure if that would make.
Whereas a 15 gets you
Yeah.
into a third school, just as an example, in CASPs,
Yeah.
right? I mean, it's a little bit apples and oranges. I understand that, but again, I don't think the loss of 50 is going to completely stop them, because they have a much more diversified portfolio of things. And
Because
then,
this is a
by the
new
same
program.
token, a smaller amount of funding, I'm not sure is even going to be worth their time.
Yeah.
But I hope that they do continue this program in collaboration with the city or with the other 7 clinics, because we see the impact every day.
Well, definitely, yeah.
So as a placeholder, again, what would you like to do with that number? It's obviously can't stay at 50, I don't think.
I would leave it blank, because it is a new program, and it's something that they
Let's
they
zero
would
that one
like to
out.
add, but it's they need funding.
So that brings us to approximately 151. Commissioner Tushin, you had some views in terms of some programs that you wanted to look at.
Well, I mean, as I indicated earlier, if we leave gift at 0 and we leave zone after school program, Salvation Army at 11 and Ararat at 11 and Housing Rights Council at 9 and increase CASP to 28 to accommodate 2 schools, I'm fine with senior services at 16. That's something I would prefer to increase. I think I indicated that, but I think due to the constraints we're under, I don't think we're going to be able to do that. And if we add that up, what does it come to again?
We're still short by 151.
Well, we have to go back and look at the transitional housing, and we still have 86,000 up there.
Yep.
So if you were to change that to 20 as like last year's number, we check.
Then we'd
try that, Iris.
And I would leave Dora Vope at 20,000.
Yep, that's what she's.
Okay, good.
That brings you down to 85.
Well, I would like to see the Homenemet program and even the zone program go to CASP, because I think it's
Which home program?
the number 3 and number 5.
Well, I think that would totally eliminate the
Exactly.
Salvation Army and Homenemet. I don't know if I want to do that.
Homenemet is a pretty strong organization, and this is the
Both of these
tutoring programs.
If you go to the Salvation Army any afternoon,
They're full.
and you see those kids there and what they do for the little money that we're talking about, I'm not inclined to either of those.
I would decrease some of the others before I completely eliminate those
If we
two.
look at the Catholic charities, we gave them 35.5 last year. They're asking, right now it's still up there at 67. We obviously can't fund the full amount.
You can't fund that. You have to leave it.
So let's look at what number to plug in as a placeholder. That's not the full amount.
Say 35 maybe, just to.
35?
35.
Put in 35, Iris, for Catholic charities. That gets us. Now we're at 53. And then
Back to
Glendale Youth Alliance is at the full amount of last year, 5,500. Essentia.
Can we cut that one?
Essentia is at
Outreach.
30, which is their full amount. If we put that back at their amount that we had last year, 24.5, let's say 24, probably not going to have, that gets you to 47.
Let's talk about if you don't mind, the Glendale Youth Alliance.
Yeah.
Not speaking about the program at all, because I think it's a great program. Last year, I believe we reduced the cost. We obviously didn't give them what they were requesting. We didn't recommend that. Did they not get additional funding from the city, from the general fund?
Mr. Allers, no, I think that's just part of regular budget, but nothing to offset the cut in CDBG. So what they did is they served less kids.
Mm-hmm.
Okay, I wanted to make sure I wasn't mixing.
Again, the youth, the Youth Alliance is another established program where I think they're doing a great job in their fundraisings. It's pretty branded, and they have great supporters. So I'll be okay if we, not reduce it tremendously, but
we're going to have to.
We
somewhere.
have to, as we have reduced funding, accordingly, kind of reflect that in some of those more established organizations' recommendations. So I would say maybe start with 42, 40, just to, because we're still like in deficit of almost 50,000.
Yeah.
And we have reduced almost.
So let me suggest this. Again, we're just kind of chipping away at this. Let's put 45 down for Youth Alliance. Remember, we had the we had the 500s in there just to make
You
the
like
numbers.
42, Mr.
I like 42. I think
We're going to have to go
I
further.
just look at our parentheses,
We can
and it's
start
just
already.
still at 40,000
41.
deficit.
Let me ask the committee a question. Our two biggest numbers up there are Armenian Relief Society and Glendale Youth Alliance. Which one would you be inclined to
I think
reduce
both.
funding on first?
We're going to have to do both
I think
to
we
get the
have to
numbers.
do both. I mean,
Okay.
as
But
we
not
have
to the
seen
same
in
extent.
Unless we're willing to lose a program.
No.
But this is where I'm having a little bit of difficulty in this, is that we are increasing one program, doubling it, at the expense of some other programs that I know we all believe are strong too. So
But see, that's the purpose of this committee, to kind of evaluate, and at certain years, we see the need for just one organization before they completely, get discouraged. 10 years, CASP is coming forward and asking for the second school. And if we were to help one organization increase their service and their program, strengthen the program, I would say I'm okay with an additional, $12,000, $14,000 just for them
Just
to get the second school
Just
started.
in terms of the services they get and how they operate, they're in the schools.
Well, so this is the question. Let me add another angle or approach, which is, so you could take your top recipients and reduce there in order to allow for CASPs, or you could, like I said, make the harder decision of eliminating one program. Are we saying that we're not going to, no, in addition to the one we already did?
No.
Are we saying we won't eliminate anything?
My preference is not to eliminate Salvation Army nor the after-school tutoring with home enrollment.
I agree.
I'm with you on that 100%.
My preference is to chip away with some of the higher numbers that we have, including the Armenian Relief Society and Glendale Youth Alliance, and perhaps to a lesser extent Catholic Charities, than to eliminate the other two that we discussed.
When you say Catholic Charities, meaning the loaves and fishes?
Right. I mean, to a lesser extent is what I'm saying. I know Glendale Youth Alliance is at 50,000. That should be reduced a bit just to make up for the increase in CAPS. I think Armenian Relief Society should be reduced also, and perhaps Catholic Charities, but to a lesser extent.
So let's start tackling those one at a time.
But I certainly wouldn't want to eliminate any of the programs.
Okay, I think I'm hearing that as a majority.
I would agree with that
So
too.
let's start chipping away at this. Would you be in agreement to bring Youth Alliance down to 40 from 45?
I would.
Let's try it. So let's take
one, I'm sorry?
Youth Alliance, put that at 40.
11.
At 40?
Yeah.
Number
36. Now let's look at ARS.
9, yeah.
Can we go down to 45 on that?
Try that.
29,000.
Can we bring CASP down to 25?
So
Well,
that's
that's at 24.
Sorry, so if I'm listening, so I can understand, it's the committee's decision to keep a new program currently that's being offered, the Glendale Healthy Kids, is that on?
Yeah, well, right now we've got it at 15, which is half their
Okay.
request.
Okay, and increasing the
CASPs.
amount for CAS for the second school.
For the second school.
So how far off are we now?
So Commissioner Markarian just asked to bring CASP down to 25.
Will that cover both schools?
They don't cover
If
both
it's not going to get
schools.
you both
Oh,
schools.
unfortunately, it won't cover the full
I
cost of the
understand,
school.
but they were willing to do some fundraising efforts to make up that 3,000. I mean, 3,000 a year, it would be expected for them to at least start the second program and having that fundraising
I agree, and I think
on the side and motivate them to
I think they'll get it
some
done.
work on the side. Yeah.
I think they'll get it done because they've done it in the past. So I
Well, I think
agree with that. 24,
I think that is such a unique program, and it's really a very effective program, and I can imagine that we would choose not to allow them to expand to another school and then keep these other programs that have been in existence for quite a while and bring in the new ones, as you said.
Well, I know definitively that they said that they need 14,000 change
Exactly. Yep.
to fund 14,664. So that's about 29,000 to fund
28 even.
two schools.
Yeah.
But I don't recall what they said about their fundraising to make up the difference. That one I don't recall.
Yeah. Again, not to penalize them, but the one strength that they have, being a small organization like they are, and how effective they are, is their ability to bring in volunteers. So I say that only because I personally feel that they've done it in the past. And if we didn't give them the full 28 for a second school and we gave them maybe 24, 25, I just seem to have the confidence that they'll get it done.
But I thought that the 14 is what they need to do the staffing, and for counseling, you need professionals.
The number,
And
I've heard two numbers, 12,000 for staff, and then there was operational costs of paper and whatever else they need, and some number, which I would imagine is the balance of 2,000. So that's why I'm saying that if we can give them enough money to put 2 professional persons, counselors, in the schools, that takes care of the bulk of it. Then they'll have to fundraise for the rest for the operational side of it.
Mr. Correa, do you think they would expand to a second school with the 25?
Commissioner Marquardt, it's challenging to say because I believe they do say they needed 14,000 per school. It's what their budgets are. They are a small organization of about $90,000 in annual income. Their grants is about 10,000. Their special events net about 17,000. So they're not a large fundraising group. So it's very challenging for them to raise any additional money to meet the gap. Now, I don't know if they could run the program 3/4 of the program and not do the full semester. Maybe it's something
That wouldn't be fair to the students that they're
would
serving.
be a shorter program than they're accustomed to, and maybe that's okay. Maybe that's just as effective, but it's hard to say what the gap is. It's much different than in the other programs where you can add more and you'll know the difference. Here it's a little more challenging.
Well, to me, the mental health is so much more important than tutoring, after-school tutoring.
Well, my suggestion is that if they need the 28,000, I think we should leave it at 28,000. I mean, I think we could make up the 3,000 from some other programs.
Well, what we haven't done thus far is that we brought in most of the programs at their 2014, 2015 floor. You could start trimming a little bit, take the 11s down to 10s, that sort of thing, chipping away at it. I mean, that's before you even deal with this CASPS issue. That's even with CASPS at 25. We still got to do that because we're still 26 short, unless you're willing to take a bigger chunk out of some larger amount.
Can we go any lower on fair housing program? 5 or no? I know that it's a mandatory funding we need to do, but they won't even.
Ms. Marquardt, they probably be that level is already probably their limit, and
You're right,
and we're
okay.
putting requirements on their audits, and you can see how struggling they are. But
so
I'm sorry to stand corrected. The 12,000 relates to the psychologist time, and the additional was a 2,000 or so would probably relate to the executive director, the administrative costs, operation supplies, art supplies, snacks. So yes, maybe that's the answer.
So let's leave it at 25 for the moment. I'm not saying this is written in stone, but like I just want to get get closer to our goal a little bit before we do the fine tuning. What about STAR at 10 instead of 12?
I don't think it will impact them significantly, if at all, if we go from 12 to 10.
Okay.
It's better than eliminating it.
Right. And what about
and if we do that, if we can do them reduced, we should be able to do the other
so
two that I saw.
What about zone and home and men at 10 each instead of 11 each?
Yeah, that's better, at least.
I mean, we just have
Makes
to
it
make
a little
progress
bit,
somewhere.
little bit equitable.
Mr. Chair,
yeah.
Just a reminder, if you look back in 13, 14, there was about a $15,000, I believe $15,000 budget for those. And then when they went down, both expressed certainly the concern that that's the breaking point. One thing, 15,000 was their normal. Actually, they had higher, but at 10,
1,000
might
lower.
be a little bit stretch for them. But
Which one is that?
The home and men after school and the zone.
The zone.
He
We're
did
just trying
say
out going
that
from 11
without
to
our
10.
funding, he didn't have a program.
So you're saying that those numbers that we have currently for Salvation Army at 11, Ararat after school at 11, and Star at 12 remain the same? Any other cuts would very difficult on those programs?
No, I think it was the after-school zone and after-school tutoring which had given us that information.
I agree.
That,
I agree. I don't think we want to cut any more out of those.
yeah, they were averaging 15, whereas I know Star was always at 12 or so.
Let me ask a different question. Do we want to create any sort of parity on the homeless programs? Because you got Door of Hope at 20, you've got Catholic Charities at 35, then you've got Ascensia at 24.
Well, I think they serve different needs. Door of Hope is specifically geared for the
Women and children.
Women and children going through domestic violence and their youth program. Catholic Charities is just dealing with the
homeless.
Well, I got
Volume.
I got the
We also have to look at the number of individuals they serve. Catholic Charity, with the amount that we're given, they have served so many. I'm not sure about Ascensia. I mean, we're leaving them as it is as last year, or do we want to reduce that
That's why
24?
I'm just asking that. I guess asking broadly about the category.
Right.
Because we have different amounts within that category.
Okay, if we're talking categories, then let's talk about the Glendale Healthy Kids uninsured program. How big of a priority is that for the committee? That particular program, again, it's a group program. It's not about the programs themselves, but in the overall scheme of things, it seems like our focus is youth, seniors, and kids. Now, kids, this program is for uninsured kids. It's trying to balance off this federal program that we all know about. Is that really a priority for us?
Because of the dental, I think it is. Nobody else does that. And
I think what they're asking is not for the dental. I think this is more of the mental health. Was this, am I right?
I thought it was the
I believe
program.
it's the health, health and mental health referrals. And
Which that's an added
management.
program.
That's an added program.
So maybe
What if we came down
somebody
on a
came up
cent-
with that program, let them fund it.
So that's already we're already at half their request.
Yeah, exactly.
What if we came down on Ascensia to 20 instead of 24?
Yeah.
18. Wow. It's hard.
It's more difficult this year.
I told you, yeah, we're
There's
so...
You know what this
There's
means?
no money and you don't want to
Balancing.
cut.
At the trend we've been going over the last number of years, next year, we are going to be cutting programs.
Yeah.
We should
We're
be
gonna
cutting
be-
them
That's
this
why
year.
I put that on.
Yeah,
It's the harder path, but you know,
Needs to
at
be
some
done.
point, if you want to give them a shot at being impactful, right?
So just another point, again, committee members, is as Mr. Olivares mentioned, is there's a breaking point of funding for each of the agencies for staffing and for our staff, and I think you've reached that point, and it's, again, decision of the committee, whether it's new programs or cutting back an existing program. Yeah, probably next year we do have to look at a cut to an existing program.
Because
this year,
many of these programs, I mean, if I were in their shoes and for 10,000, I'd have to really weigh whether or not it's worth the administrative burden.
In fact,
It's a
that's what they
diminishing
pointed
return.
out, right, last year?
All the reporting and everything,
Yeah.
I'd probably go and try and raise 10,000 before I try and get 10,000 out of CDBG because
We're already starting to
because of
see
the burden.
that. Yeah, we're seeing that. We saw it last year.
Yeah.
I would, at the risk of not being popular on this one, but I would not fund Healthy Kids. Just so we can keep the level of services on every other existing program that's there.
So, thank you for that thought. Let's put it out this way, just so we don't look at it in isolation. Are there any other programs we would look at on a list of candidates to cut completely in order to get us there?
I mean, as far as category mental health for children, if we're increasing CASP, because that's pretty much, you know, elementary level school mental health needs. And then Healthy Kids is pretty much aligned with that, you proposal. Would they, as a startup, would $10,000 help, or do you think again administrative burden would
For healthy kids?
for healthy kids if we were to reduce that?
Well, Commissioner Markarian, my understanding is they will take that certainly to get started as a pilot.
But let's put that in just to see.
That helps.
Make some
yeah.
progress.
10,000 for Essentia?
Healthy kids.
Healthy kids?
That gets us to 13 deficit.
What's our deficit now?
13. So
What do we have Catholic Charities at?
Catholic Charities is at 35, so that would be the next one to look at. What if we went to 30 on that?
Yeah, let's try.
What did you do with those 10,000 number finally?
Now we're at 8 with Catholic Charities at 30,000.
And we left Essentia at 20.
And CASP is at what,
25.
And we left at Essentia at what, 20? Is it 24?
Essentia is at 20.
Is at 20, okay.
What if we did senior services at 15 instead of 16? That's 7,000 now.
So we kept Door of Hope the same as last year.
Yeah, that would be the next one to look at. Because pretty much everyone's taken a cut from last year's levels.
Except
even,
for CASPs.
even those at 11,000, except for CASPs.
We can start with 18 on that one, just to leave.
Yep. Let's put Door of Hope at 18. Now we're at 5.
We take that from the two main ones?
The difference comes back to what you were saying, which is the new entry of Glendale Healthy Kids. If you took Healthy Kids out, then you'd be 5 under budget. What? Sorry, Commissioner Markarian?
No, I'm just looking at the two large numbers, and I'm trying to see if we can chip that up from the main two, the 40 and the 45, each 2,500. If we were to keep the,
So let's
the
do,
Healthy Kids program in place.
so let's do 42.5 for ARS, and
What do we make ARS?
37.5.
Just make it 40.
sure. Now take a look at it. So let me, since Commissioner Tushing can't see that, let me read it, and you can maybe write it down on your write it down on your
That would help.
spreadsheet. And I'm sure the people viewing at home can't see this either. So get your piece of paper and pens out. So transitional housing program, and this is not final, by the way. This is just still proposed. Door of Hope is at 18. Healthy Kids is at 10. Salvation Army is at 10. Gift is at 0. Home Minute Men is at 10. Fair Housing Program 9. CASPs 25. Catholic Charities 30. ARS 42.5. Senior Services at 15. Youth Alliance at 37.5. Sensia, I said Youth Alliance is at, I said 37.5. Essentia is at 20. And STAR is at 10.
And we have?
And that's 0.
0.
I'll have to write a check for STAR program, I guess.
One way to fill a gap.
Yeah.
So what are your thoughts, Ms. Correa?
All right, so we left the tutoring at 10, not 11, right? 10,
Correct.
and I think the staff recommendation was that
11 was a breaking point.
Was a breaking point. So I'll say, can we just go back and, well, that'll
We'll be
give us a
back up by
deficit
2.
of 2,000.
I wanted Mr. Carrillo's thoughts on these numbers right now.
Well, thank you.
Sure.
I can give my thoughts. It's certainly it's the committee's will for this, but certainly as we discussed, our intent is to make sure agencies are able to operate their programs at the funding that at least currently have, or slightly reducing them. And unfortunately, new programs probably wouldn't fit that criteria per se. So it is something we would want to look at as far as, well, performance-wise and who's doing well. And I think all of them are performing well. But again, the calls will come back to me saying, well, if it's at 2010, I can't do it. And there's probably 3 or 4 that may do that, or they may go to City Council and request that process to be reopened up and looked at again. But that's certainly the risk that we always take. So I just want to point that out. It's just margins are pretty thin now with the agencies, and I know their response is, oh, how could we fund new agencies or increase other agencies, whereas I'm going to probably lose my program, and that may be several of them. But we don't know yet. We won't know until they can respond to this.
Well, which one do you anticipate will basically come in and say, hey, listen, at this funding, we're going to completely lose the program?
Because it's not worth it to us.
I don't know which ones. I don't know what their
I don't think
matching
it's
funds
fair
could be.
to
It
ask.
could be the Salvation Army.
No.
I really don't think it's...
Closer to 10, 11.
I guess the other way to look at it is that we should anticipate that there could be one of these that would come back.
Well, he's saying 2 or 3 may come back and tell us that,
Well,
hey, listen.
My
the past-
personal opinion, and I agree with that, is the smaller organizations are going to do this. They are the home and admins, the ones that were at $10,000,
Exactly.
$11,000, $12,000. That's exactly the reason why I insist on not funding the new program and putting that money back into those programs.
But that's
to keep
not
it
funding
where
the new program hasn't been factored into the money that we have.
We
got
did
10,000.
But we added 10,000 to Glendale Healthy Kids.
Oh, but I'm talking about the other one that we didn't fund.
No,
Yeah.
correct. But those $10,000, you put back 1,000 or 2 to home and admin, put it back to the smaller programs. They at least can count on the fact that they're being funded at the current level. And they managed to survive last year.
But what about the discussion that this basically tells new programs out there, hey, listen, we're not going to fund you because we don't have the money to fund you. That's going to discourage them from coming forward.
Unfortunately, that's a fact.
Commissioner Markarian pointed out.
Although I guess I would clarify one thing, Commissioner Olivares, is that what we want to be sure of is that it's not just because they're previously funded programs that they're automatically getting the money. We feel that the programs that they've been running and are running are more effective. You are making a judgment call. You're saying they're more effective than what the potential for the program that the other organization is going to use your money for. Again, it's not a commentary on, let's say, if we use Glendale Healthy Kids as an example, it's not a commentary on their effectiveness as an organization. It's more about, is their program going to, in some way or fashion, Glendale Healthy Kids is going to continue contributing valuable way to the community, because they have been. Some of these other programs might be at risk, which are also important programs.
Well, Chair, my humble opinion is that Glendale Healthy Kids has a very good structure. They've been around a lot longer than perhaps some of these other organizations. They have funding, they have donations, they have access to organizations and corporations and companies perhaps some of these smaller ones do not have.
Right.
So perhaps your suggestion, Olivares, is right. Perhaps we shouldn't fund Glendale Healthy Kids, and we have 10,000 remaining where we could distribute among those that are at risk.
At least, because the three that we've come in, putting the fair housing aside, the 3 lowest funded are all in the same category, interestingly enough, which is at-risk youth. And I hate, except for CASPs, yeah.
So we would be
But
talking about...
in terms of healthy kids,
Salvation
look at the
Army.
number of kids they serve
If you took Glendale
compared
Healthy
to what
Kids
the
out,
others serve.
as you're suggesting, and reallocate the 10,000 to the 3 after-school programs, right?
Salvation Army.
Salvation, Home and Men, Star.
Correct.
Right?
And then we have...
Bump something up by 500.
Right.
Or by 1,000. Do 3,000 on each of those and add 1,000 somewhere.
Maybe on the CASP?
Yeah, and that gets you to the full school. Can we try that, just to see how it looks? So zero out healthy kids. 1,000 on 2,000. So that gets them 12. Permanent Men 12. Star 12. And CASP's 20. Where's CASP's? Go up 1,000. 26.
So Salvation Army is at 12?
Oh, sorry. You just did 2 each? Sorry, I meant 3 each on the others. So add another 1,000 on each.
So how much is, what are we at with Salvation Army? Okay. Okay.
There, okay. So Salvation would go to 13. Hominid would go to 13. Star would go to 13. And CASPs would go to 26. If we wanted to get CASPs to its full amount, which is I think where you were going, Commissioner Tashchand, you could bring Star back down to their original of 12 from last year.
No way. If you're doing the others 13, you should leave that one at 13.
I have to say that I think what we got right now would be very fair. Even without what you're starting to suggest, I think it would be very fair for the following reason.
Got them all at the same level.
CASP got an increase because we feel strongly about it, and also about the other programs like Home and Ed Men, the after-school programs. We're giving them a very slight increase, $1,000 each page, or a couple of thousand. We've reduced some of the larger numbers, which I feel we needed to do. When I look at those numbers right now, I'm very comfortable because we did show a little more support for those very small organizations that are marginal right now. We don't want to put them in a position where they're going to come back and say they can't provide the service.
Right.
And I do.
So let me. You do.
Sorry,
you do what?
I think that when they're at a breaking point, this is the time to defund.
Oh, like not just erode, but.
Yeah.
Yep.
Because in fact, they pretty much told us that they need this funding.
That's exactly why I think this is fair, because we've shown a pretty good balance, in my view, of supporting those that have been getting reduced every year. We actually increased a few of them. CASPS is going to be very happy.
They should be, and I think we have a responsibility to address those needs, especially when they operate out of your schools. When you know how much it saves them to be able to operate out. They can do this program because they operate out of the school.
We can say that about any of those programs up there.
No, you can't.
Honestly, we can say that every one of those programs that has been funded currently provides some very strong service in the community, and if we were to give them an additional 10,000, they'd be very happy and they'd provide more services.
Oh yeah, but that's not the issue. They're all effective. There's no doubt about that, or we wouldn't be sitting here. It's just in terms of the funding that we have and the services that are provided for the greatest need.
That's why we're
I just feel like
here.
we're pretty much balanced on different categories. I feel comfortable with the recommendations at this point. I know that youth, senior services, homeless, everything is addressed. Given the amount that we have in our...
So can I ask one other balancing question? We kind of addressed it, but I just want to make sure we've put a period at the end of it. So on Catholic Charities homeless program, you got that at 30. Essentia homeless program, you got that at 20.
But they serve completely different number and volume.
And populations.
So
Essentia, there's nobody else like Essentia in town.
Right.
There just isn't. So,
But also in terms
One
of
is more of food
difference, in terms of difference between requested and what they're receiving, there's a pretty big differential there too. Essentia requested 30, they're getting 20. Catholic requested 67, they're getting 30. So they're getting about 50%, whereas the other one's getting about 2/3. Is getting 2/3.
I see your point.
Yeah.
I mean, if we were to look at
But what is your
ratio.
suggestion?
All I'm doing is pointing, I don't have a suggestion right now.
Okay.
All I'm pointing out is that are we making sure that we've overtly discussed it, that there is some differential there, that there is a point you're making with some differential there in terms of they're both in the same category. They approach the problem a little bit differently. I'm still okay with it the way it is. I just want to make sure we're seeing it and then we're.
The one is more of a prevention program. The other one is already like placement program of homelessness. And just looking at the Catholic Charities, I mean, the support, probably the name out there, the fundings they're receiving from other sources would supplement and would keep them provide the services as needed. Essentia is more local. It's really about taking away the homeless, individuals out of our streets and placing them. That's pretty important too. So.
Well, they're all important. There's no doubt about that.
But
yeah.
as far as the way we funded.
Well, I think we could rehash this and over and over and over again, and I think these numbers are fairly reasonable and fair.
With what we have to work with.
Exactly.
I would agree, and I'll suggest that next year when these proposals go out, these RFPs go out, there should be a question. What is the amount at which you would not be able to operate?
At which you would not.
I asked that of Homenetman, and he told me 11,000.
I'm suggesting that next year when we put out these RFPs, that should be a question with an explanation, so we have we're in a better position to evaluate that particular situation.
Yeah, I think.
I think
we stop here if everyone's in agreement. I would make one comment, is that this is obviously a recommendation to council. At the end of the day, council can decide differently if they so wish. And as things become tighter like this, I would not be surprised if council comes back in and plays around with the numbers. But that's their prerogative at this point. This is our best effort at trying to be fair and looking at the merits, as well as it's not a commentary about the value that all of the applicants provide. It's a matter of diminishing funds that, if you bring them down too much, becomes diminishing returns.
And I agree with what the chair has said, and I will add the following. This is a strong recommendation to the City Council because we've read these things very carefully. Something that I'm not always convinced happens on the other end, and political influence can try and make changes. So
that's why we're going to Washington. Remember?
Well, the other recommendation I guess I would make to my colleagues here is that, we've had a lot of discussion here. We've been here for over 6 hours. My recommendation is also to reach out to the individual council members on a personal level to share with them our deliberation process and our thinking, so that when they do go into their session to consider this, they have the benefit of each of their appointed committee members' input on this. I think that's very important, so that they're not looking at it just on a spreadsheet. Mr. Carrillo.
Yes, thank you, Mr. Chair. Thank you for mentioning that. So what I wanted to do just for the wrap up is to maybe for staff and for our report is the reason. Certainly we can go one by one, but in general, was there a general consensus on assisting certainly those nonprofits that are doing great but are in the lower funding area, to keep them funded in lieu of cutting, because I think those
Just the
recommendations.
word I would use is viable.
Viable, okay.
Yes.
And I think the numbers reflect that. I think the numbers and our conversation back and forth reflects that.
And the second pattern I see is the youth agencies, which have been, I think, kept at a level from last year, but youth mental health seems to be an area too but the CAS program, an
Yes,
area of...
and the way I would, I guess, characterize that, because I think we have to explain that that's the only one that stands out from the general, trend, is that we strongly believe that program has the ability to exponentially expand its impact if given the chance, and they've been coming at us for several years hoping for that opportunity. So we'd like to give them that opportunity this year, see how they do, and see what results that might achieve for us this time next year. Do you agree?
Certainly.
And that I'd like to move that we accept the numbers as proposed.
Okay. Would you like me to read them out for the record?
Yeah, let's read them out one more time.
Transitional housing program for homeless women and children, Door of Hope, $18,000. Access to health care for underinsured children, Glendale Healthy Kids, 0. The Zone After School program, the Salvation Army, $13,000. Gift program expansion, Glendale Individual and Family Treatment, 0. After school tutoring, Home and Men, Glendale Ararat Chapter, $13,000. Fair Housing Program, Housing Rights Center, $9,000. Intervention Prevention Clinical Group Counseling, CASP, $26,000. Homeless Prevention Program, Loaves and Fishes, Catholic Charities of Los Angeles, $30,000. Community Outreach Project, Armenian Relief Society of Western USA, Inc., $42,500. Senior Services Program, Glendale Community Services and Parks Department, $15,000. Youth Employment Program, Glendale Youth Alliance, $37,500. Homeless Outreach Case Management, Ascensia, $20,000. Students Training as Role Models, STAR, Glendale Police Department, $13,000.
Okay, so we have a motion from Commissioner Olivares.
I'll second that.
Seconded by Commissioner Markarian.
Take roll call. Committee members, Markarian.
Yes.
Olivares.
Yes.
Ramirez.
Yes, I notice a big discrepancy between the Catholic Charities and the Armenian Relief Society, however. Yes.
Atashian.
Yes.
Chair Armenian.
Yes. Okay.
And next on the agenda is item 5, which is committee staff comments.
Any last comments from my colleagues?
This was difficult, but we got through it, and thank you, Mr. Armenian, for your leadership, for chairing the committee, and I want to thank the staff, Mr. Correo and Iris, for always supporting us.
I hope Jess is having a good time wherever he is.
Sure he is.
But no, I want to thank the chair and the committee.
And the vice chair, Mr. Tashjian.
Chair.
Thank you.
And on Monday, we're going to talk about other programs and a new item that we're going to discuss, and so.
I would also like to thank the chair and the committee members and also the staff. Unfortunately, due to prior commitments, I will not be here on Monday. Good luck to all of you, and again, thank you for...
We'll miss you.
You.
Commissioner Ramirez, any last comments?
Well, I think you ran a great meeting.
Very much. I appreciate the cooperation and collaboration. It's a great committee to serve on. I know these are difficult to get through. I appreciate the integrity with which everyone approaches this process, and I especially thank staff. I know there are countless hours that go into those 4 or 5 feet worth of paper that you distribute to us, but it's very important for the integrity and transparency of the process to have that sort of background material. So I do appreciate the effort that takes. It is worthwhile to see that, to help inform our thinking. So thank you very much, and we will see everyone. Yes.
Yes, Mr. Chair. I just wanted to advise the committee of obviously we know Monday is March 2nd is the next meeting of the advisory committee for the capital improvement projects. And then following that, we will be publishing the list of recommendations approximately March 6th in the news press for the public to review the recommendations And on March 11th, we're tentatively looking at a public hearing to have the public again comment at a hearing on the recommendations.
This is a hearing by staff?
This hearing by staff for the community.
Okay.
Location?
Usually it's Pacific Park Community Center. We will verify that once we have all the dates. And April 7th is our tentative date for the City Council recommendations for
Isn't that
approval.
election day?
No.
Yes, isn't it?
Oh.
It may be,
Yeah,
so
it is,
that
you're right.
may change. That may
Yeah,
change.
that should change.
election day.
Yeah, you're
It
right.
is.
Yeah, I think it is election
For some
day.
reason I had this
So maybe set the 14th, but we'll verify that.
Okay.
But if there's any other comments, please, between now and Monday, please let us know and we'll
Okay.
work on it.
So again, Monday, we will cover the capital projects. Shouldn't take as long as today. And then second, I'll re-emphasize the importance, I think, of each of us talking to our appointing council members to brief them on our thinking so that they can go into their session whenever it is in April in an
Oh, really?
informed manner.
We should do that?
I would encourage it. So that they can hear from you personally. Obviously, if they want to, they can watch 6 hours of tape, but somehow I doubt that that's going to happen. So at least we can give them.
You mean
the
to say I can give my
abbreviated
council
version.
member my opinion?
Your feedback.
Okay.
Also, all the applicants who came today and presented
Yes.
their project, we want to thank them all. Great work they do in the community.
They really do valuable. We're unfortunately don't have as much resources as we would like to have because all of their programs are very, very worthwhile and play an important role in maintaining and improving the quality of life in our community. It's programs on this sort of grassroots level that make all the difference. So we appreciate all their work as well as they obviously all do more work than this funding allows them to do. They do it through other means, and we appreciate that effort. So with that, we will adjourn. Do I have a motion to adjourn?
You don't need one.
Do I need one? Okay. Then we are adjourned. Thank you.